million reported cases. New York City has 216,834 reported cases. And in Manhattan in particular, there are 27,641 confirmed cases. And as many of you may have heard in the news, there is a slight uptick in positive cases among the 20 to 29-year-old demographic. We're not exactly sure at this point what is causing that, but as we all know, as the city has begun to open up, there are people gathering, outdoor dining. There have been protests and people exercising their right to protest. So all of this could contribute to that particular segment of the population seeing an increase in positive cases. So what we really want to make sure people are aware of is to maintain the core four, which is stay home if you're sick, maintain social distancing whenever possible, pretty much always, wear face covering in public if you can't maintain social distancing, and wash your hands frequently. As you may also know, the state has issued a joint travel advisory with Connecticut and New Jersey, requiring individuals from certain states to have a mandatory quarantine for 14 days. I can provide a link to the state's website for all of those states that are included in this travel advisory. And then large gatherings are canceled through September 30th. But childcare programs have been allowed to reopen. Just because they're allowed to reopen doesn't mean they should or they want to. But if you get any questions about childcare facilities, they are allowed to be open at this point. And I think I'll just open it up to any specific questions people may have.
Thank you, Pauline. I just want to make, I just want to note for the benefit of people in our community that I want to bring the statistics down to our community level. So at this point, according to the DOH website, there have been 910 deaths in our 4 zip codes, and zip codes 32 and 40 rank 77 and 78 out of the 177 zip codes in the city in terms of cases per 100,000, and zip code 32 has had 281 deaths. Zip code 40 has had 263. Zip code 33, which ranks as number 94, has had 203 deaths. And zip code 34, which ranks at 126, has had 163 deaths. Now, let me ask you, Pauline, when these deaths are listed on the DOH website, are those confirmed deaths, or are they also probable deaths?
So I think there's a tab that differentiates between confirmed and probable. Let me just double check our website to see whether or not the ones listed in the data page, specifically per zip code, is confirmed. I'm pretty sure they are confirmed, but let me just double check that. Are there any questions while I'm checking our website?
Yeah. Are there any other questions?
Yes, I have a question or two.
All right. Is that Sally?
Yep.
Go ahead.
Okay. In terms of the uptick in the 20 to 24-year-olds, do you have any data on where those cases are coming from? Because I can tell you at our open street on Dyckman, it's a super spreader event every day. So, yeah, there's right. No.
So the age range is the 20 to 29 right. Age group. And as of right now, we aren't seeing the typical where we were seeing disparities prior. So neighborhoods where we were seeing disparities or poverty rates, they're not sort of overlapping. So we're thinking it's because of the reopening that is causing some of the uptick.
Yep.
Yeah.
And then my other question is, have you made any progress with the contact tracing? I know at one point the response rates were in the 30s.
So I can definitely circle back with H&H with regards to their test and trace program. The last I heard was that they are doing slightly better in terms of, reaching out to contacts and people providing helpful contacts. But let me circle back with their team and I can email Steve some more information for him to share with everyone.
That would be extremely helpful.
I appreciate that. Any other questions?
Steve?
Ms. Bonner?
Yes, hi.
Tanya, hold off for a moment.
Oh, sure.
Paola, I see Betty Lehman's name on the additional attendees list. And she's not on the main list.
She's promoted.
Has she been promoted?
She has.
She's on now. Yeah.
She's on now.
Okay, very good. All right, Tanya, I'm sorry, go ahead.
Yes, I actually saw a question in the box that said, someone asked, Claudia asked, has anyone considered whether the uptick in positive cases in 20 to 29-year-olds has anything to do with fireworks and motorcycle parties? So maybe, I don't know, Pauline, if you wanted to address that.
So I don't believe we have any specific data as to what could be causing this uptick right now, but we have heard that there have been a lot of gatherings where fireworks have been used and other things. I haven't heard about this motorcycle situation, but any time where people are gathered in large crowds, not practicing social distancing and not wearing the proper face coverings can all potentially be contributing to this uptick. So while I don't have that specific information, this information about these parties and fireworks and gatherings it's something you can call into 311 and have the mayor's office of special enforcement send out people. Like if there's a particular party that happens every single night or every single Saturday at a particular time, I think that would be really helpful to let the mayor's office know so they can send out folks to either hand out face masks or, do some education, break up some parties. Again, we don't really want to be sending NYPD out to these situations at this point, but I think it's really important that people still understand that COVID-19 is still a concern and we don't want to go backwards and start closing things down again like other states have had to do.
Well, I tell you what we have in this community are people who are just hanging out on the streets at night, having their own little parties and not wearing masks. And, they bring out their beach chairs or whatever, and they just sit on the sidewalk and they stay out all night long. So do you think this is something the mayor's office of special enforcement could respond to? This is a late night situation.
I mean, it wouldn't hurt to let them know. And I know the mayor's community affairs unit has also expressed that if communities are seeing particular issues and concerns that they should be notified as well. So I am thinking that they would potentially send out inspectors from various agencies to come out and see what's happening. With regards to any restaurants and the open dining stuff, I think the governor just announced, because he's very concerned as well, that there's a 3 strikes and you're closed rule. So if they are notified of a particular establishment that is not following any of the guidelines and, inspectors are sent out 3 times and they're found to be in violation, the state will close that establishment. So I think it's really helpful just to let the city know what's happening so that, bad actors will have to be addressed.
And
I'm sorry.
Steve, I'm just curious on this
Darryl?
issue. On this issue, we don't have H&H and their tracing unit on this call, right?
No, we don't. No, I didn't.
Okay.
I didn't invite them, but
But Pauline, is that something they might know in terms of pinpointing? I don't know how specific they can get, geographically speaking, but is
Yeah,
that
I
something
mean,
they
it
can do?
might still be a little bit early, but I'm pretty sure they have preliminary data as to what zip codes they're seeing more of a uptick in positive cases. So yeah, I think it wouldn't hurt to reach out to H&H Test and Trace to see what they're recording.
Pauline, I wonder, just sort of following up on that, the open streets, open restaurants was put out rather quickly.
Mhm.
I mean, both from the business standpoint, I think they revised the regulations, but there's a lot of things that are supposed to be being enforced by the restaurants, which clearly are not being enforced. I wonder if it makes sense for Department of Health and Mental Hygiene to have a direct conversation with Department of Transportation and the Mayor's Office of Special Enforcement, so that at that level, you can actually address those problems and reiterate what the regulations are. We can always call and complain, but I haven't heard of one successful open street, open restaurant. It's just not working. It's not being enforced. And if we talk to our police, they say, well, people can't have masks on because they're eating. And it's, you know, it's not just that, it's the crowds of people waiting to be seated. It's the parties that are going on surrounding these open streets. And I think that a conversation has to be had at a higher level so that what's not being done can sort of be done all over the city, because I have no doubt that the rise in cases is a direct result of what's going on in our streets.
Sure. I think the coordination is happening. I think just unfortunately, because of how quickly things were rolled out,
Right.
it's just difficult to have, restaurants or operators who are really hell bent on just getting their business back, to really try and do their best in terms of maintaining that social distancing for folks who are waiting, or just following the rules. There are some restaurants that really are trying their best, but unfortunately, there are a lot of people who are really just not following the guidelines that the state has put out. So, yeah, absolutely. I think City Hall is very well aware of the situation where people are gathering and restaurants are not following the rules, and I think now the governor is very, very concerned too. So I think there is that coordinated effort now with enforcement. I think earlier with the rollout, it was more about educating folks and not trying to find them right away, because of course they've been out of business for a while and we didn't want to be punitive towards them. But I think now that they've had a chance to really understand what's happening, I think enforcement will start rolling out in a much more aggressive manner.
Great, thank you.
Yeah,
Paola, sorry to interrupt.
I'm-
Richard Allman needs promoted if you don't mind.
yeah, I just want to step in really quickly, Pauline. I'm sorry, just to kind of echo what's been stated already, and also just add a little bit more context. I do think we're beyond the point of just grace period. It seems like there was this time period where businesses were allowed to keep their establishments and kind of operate as, in an effort to get their businesses and make some money after being out of work for such a long time. But we see the uptick happening, and I think it's a larger danger to the community to allow this to continue to happen. I've caught, for my very first time last week, I caught 311 myself, and they did respond. But I'm just, which I missed earlier, you were saying that after 3 kind of violations, are they being fined after one incident, or does it take several incidents to occur for them to be fined for their infraction? Could you kind of elaborate?
Well, I think,
Um,
as I understand the governor's 3 strikes and you're out policy, it really involves liquor licenses. Am I correct on that, Pauline?
yes.
I think what he's doing, and they did it with the White Horse Tavern in the Village, is
Yes.
they rescinded the liquor license for establishments that are not observing social distancing at least 3
Right.
times. So
Yeah,
Correct.
that's,
Because
I knew that happened. That was a great example of what the possibilities are. But my concern is, we had the grace period for several, almost a month now, right? And then now we're saying the 3 strikes. I'm not sure if waiting 3 times for an infraction is the right approach. If someone has had a grace period for a month already, and now we're entering, and they're in, they've had several visits, even one visit is enough to be fined, in my personal opinion, at this stage of where we are, because of the uptick in numbers. So I'm just wondering, are there no sort of violations or summons being issued after the first or second violation? Is it only after the third?
So I think, yeah, right. So there are two different or separate sort of ways that a business can be fined or punished. So the one with that the governor just announced was through the SLA and taking away their liquor license, which I believe a lot of businesses really depend on their liquor license to recoup a lot of their lost revenue. But for the city side, I believe that if any of the inspectors, so it could be a DOHMH inspector, it could be a DOT inspector, it could be a FDNY inspector, anyone who's sort of in this coalition of inspectors to go out to inspect social distancing violations in open dining, if they find that a restaurant is in violation, I believe that they can issue a fine right away. And I believe that DOT can shut down that operation. So I don't have the specifics of what the like fine schedule is, for example, but I can look that up and I'll definitely send that over.
Thank you very much.
All right, thank you.
Steve,
Okay, hold on one second. I now want to announce that we have a quorum. We have 7 committee members as well as 4 other board members. We can proceed now in good faith.
wonderful.
Uh,
So
uh,
I just had a question about that last point, I
Yeah,
think,
go
or
ahead.
what folks have been talking about. And Steve, you might know this better. Obviously, when it comes to the licensing committee, there's a number of questions that they ask during their meetings. How do we work with them to get these health related questions onto their business? So they're asking whether or not, folks have had violations as it relates to, COVID and whatnot, and what are their procedures for.
I think that's an excellent point. I don't know that they're holding any more meetings during the summer to review license applications, but it would still be relevant, I'm sure, in September. And we should certainly talk to Isidro, and I'll pass that on to him. That's a very good point.
Steve?
Tanya.
Yeah, I wanted to say, as much as I'm on the business development committee as well, so I also agree with Daryl, like that needs to be also on the agenda for business development. But also I wanted to say a lot of this, this lack of social distancing, lack of mask wearing, that's happening just by people hanging out on the street. Like, honestly, I have contacted, called 311, reported that there are literally whole parties of 30 people right on the block, on the sidewalk, pregnant women with children, out partying at 11 o'clock at night with no masks and no social distancing.
Yeah, well, that was the point I was trying to make earlier, that I think a part of this problem is the people just hanging out on the streets, having their own late night parties outside their buildings, bringing out chairs and just hanging around on the sidewalks.
And here's the thing, Steve, what they said to what, police show up, right? They say, well, we give these people we give them a summons or whatever, but then they're right back doing it. There's no way to like stop people from doing this, because those things don't mean anything. And so, I mean, it's just really frustrating. It's like, this is putting our whole community at risk, to people, like, as Curtis was saying, keep allowing people to keep doing it again and doing it again and again, and there's no penalty. Then what? I think there needs to be some type of penalty that's actually going to be meaningful in order for people to be a disincentive for people to continue to engage in this behavior.
Mm-hmm. And Steve, just to point out in the chat also, 2 people have brought up specific spots in the neighborhood. Broadway and 161st Street, as well as Elwood and Hillside. So I just wanted to.
Well, I tell you, I think we should compile a list, but the list I think is going to be very long. So we should have a further discussion about how to handle that. And Pauline, I'll talk to you further offline so we can figure out whether it's the Office of Special Enforcement or some other entity that should respond. Okay. Any other questions for Pauline?
I just want to add, I'm sorry, can I just add one point? I'm sorry to jump in here too much, Steve, where public safety matters, but the NYPD, they're no longer enforcing social distancing. So that's a really important thing to mention to everyone on the call and who's listening. I've had several, I believe Bernard is on the call. I talked to him several times. He lives at, 161st Street. I've received complaints all the way up from Inwood as well about the same particular issue about no one really is enforcing. NYPD is not enforcing social distancing. And, I think that there's just a lack of enforcement happening right now in the community, and it is concerning. So I do agree with Tanya. We have to figure out a way. I'm not sure who should be responsible, but we have to figure out how to make someone responsible.
And Curtis, I would just add, oftentimes we refer people to the precinct community council meetings. Is it even worth it for this?
They're not meeting.
No.
Well, I know they're not meeting right now, but I mean when they go back.
But Daryl, they basically said we're not enforcing.
Yeah.
34th doesn't even understand what social distancing is, nor do they understand what a mask is. But I mean, their hands off.
Oh, they put up barricades in front of their precinct.
That's right. But I mean, if a complaint is filed, and I don't believe that the police are the right people to enforce it anyway. I'm trying to get them out of the business of enforcing.
All right.
They basically are closing out complaints as soon as they're filed.
Yeah, well, that's another issue we should talk about at some point. All right, I think, Pauline, we can excuse Pauline.
Thank you, Pauline.
Thank you. Oh,
She's
and Steve,
welcome
just
to
getting back to your original question, there is a chart for confirmed deaths, and then there is a chart for confirmed and probable on our data page. So if you want to just double check the information that you looked up, but we have both.
So the zip code breakdown that I'm looking at, there are two different zip code breakdowns, one that incorporates the probables as well as the confirmed?
Yep.
Oh.
So I can send you a link to both in an email.
All right, yeah, please do that. Okay, because I think I'm only looking at the one for confirmed deaths, which is bad enough,
Right.
All right, very good.
Thank you all. Have a good evening.
All right, thank you again, Pauline.
Yeah.
All right, Columbia is up next. Ross, are you on the line?
Yes, I am.
Do you want to introduce your colleagues?
Sure. Very quickly, I'm joined by several people. Some of you may have met. Obviously, Sandra Harris is with us tonight. Dr. Rafael Antigua is also with us, both of whom have obviously been to community board meetings and helped this committee before, but also joined by two colleagues from our Department of Psychiatry, Dr. Harold Pincus and Linda Rosenberg, a member of our faculty in psychiatry. You're going to talk about an initiative they're working on in terms of providing increased mental health services to the Northern Manhattan area. So Harold and Linda, I'm just going to turn it over to you if that's okay.
Thanks, Ross.
One second though, before we let Ross go, I want to once again acknowledge the Archie Bunker easy chair in the corner. I hope you're getting full use of it during the COVID-19 period.
Yes, indeed. Yes, indeed.
All right, very good. I'm sorry, Dr. Pincus?
Sure. So I'm Harold Pincus. I have several roles, but I'm a professor and vice chair of psychiatry at Columbia, and I also am the co-director of the Irving Institute for Clinical and Translational Research. So I just want to say hi to Fern, who's here. We work very closely with her. And so what we focused on is the fact that, the COVID-19 pandemic is something that, on the one hand, focuses primarily on issues around infection control, and has had a devastating impact in terms of healthcare. And the focus is not just on healthcare, though. It also affects behavioral healthcare. It has affected every single citizen in our community in all kinds of ways. Not just the added stress that they experience, but the grief that families have had to deal with, the impact of unemployment, the impact of the exacerbation of existing mental health and addiction problems that has gone on. And it has had a significant component that is affecting not only sort of people getting hit by the virus and families, but it's affecting everybody, young and old, of all stripes. And it's also laid bare not just the tremendous existing needs for behavioral health in the community, but also the significant disparities that are faced by different populations that have been traditionally underserved. And so that's really called our attention to figuring out how to deal with some of these issues. On the, I guess, I wouldn't say positive side, there's also been an opportunity to kind of learn about new innovative ways to address mental health needs. Obviously, the advances in telemedicine, telemental health care, using technology in different ways. And also the way in which people have begun to think of ways that specifically are dealing with some of the unique stresses that come up in the context of a pandemic like this. So our department, a group of us in our department, along with others at Columbia University Irving Medical Center, including Dr. Lantigua and others, have come together to try to think about what could we do, what could we think about in terms of proposing to try to make things better and try to deal with both the existing behavioral health needs that are facing our community and disparities that exist, but also to address the impact of COVID-19 itself. And so we came up with what we think is a kind of an integrated sort of initiative that addresses several things. Number one, it supports efforts to respond to the behavioral health needs of Northern Manhattan. Number two, its idea is to foster community resilience and wellness overall, not just deal with specific behavioral health problems. We want to support the existing community-based network and social care network and organizations in the community, but also as we do this, to serve as kind of a local and national model for how to address behavioral health needs in this context. And also, with a particularly innovative approach, would be to provide training and employment for community laypersons as part of a new community behavioral health core. So what we put together is a composite of 6 different ideas that are all kind of linked and integrated, but are based upon sort of our experiences and some of the tools and resources that we've, think that are needed for this area. So number one is focusing on the needs of healthcare workers. In this case, we've actually had some direct experience in doing that. Being the epicenter of the pandemic, especially in terms of what we've been faced with at New York Presbyterian Hospital and at Columbia University Medical Center, especially over the past several months, had a huge impact on the mental well-being of our healthcare workers. And as a result, we developed a very innovative approach to try to deal with some of those issues that we've called COPE Columbia. And I'll come back to that in a bit, and Linda will also sort of expand on that. Number two, we think that an important element of a strategy to respond to these needs is also to build linkages and support with existing licensed behavioral health facilities in the community, both from the mental health side as well as from the addiction side. And to do that in a way that supports them using sort of telehealth services and also this notion of a community behavioral health core that I'll speak about in a few minutes. Number three is that we also want to make sure that there's linkages to existing community-based organizations that are providing primarily social services, because many people who come through who have these social service needs are significantly affected by behavioral health problems and that are exacerbated by the pandemic. Number four, many of the primary care providers in the community see what's going on in terms of mental health stress, depression, anxiety, increased substance use, and they need additional support. So to think about how we can advance integrated primary care and behavioral health care with local primary care providers. Number five is that we want to create this behavioral health core, which is an important part of their strategy that actually would engage people in the community, lay people in the community, and train them in providing behavioral health services, providing supervision for that, integrating them into these other 4 components. And then finally, we want to do this in a way where we can continually assess how we're doing, continuously improve the work that comes out of these initiatives, and really make it a sort of national example of a learning health system and community partnership model. So why don't I stop there and Linda, let you sort of expand on some of these items, especially the Behavioral Health Service Corps.
No, 1 second. I want you to repeat that last sentence about the national example. What was the rest of it?
That I want that we would create a national example of of what might be termed a learning health system and community partnership model. That there really would be nothing like this in the country. So that's what I was referring to.
So thank you. And
Okay, very good.
thank you, and thank you for having us this evening, and a particular thanks to Dr. Lantigua, who really came, I think, to our chair, Jeffrey Lieberman, and said, our community is suffering. You're part of that community. How can we be helpful? So thank you. And I'm very happy to be here tonight. I hope you'll feel free to interrupt me, by the way. And I really...
Oh, Doug, you don't want to invite us to do that. You'll never finish.
It's okay. I can handle it. But it is really a pleasure. I want to talk a little bit about a few things. First of all, we want to do this in a very respectful manner. You have community-based organizations that have their own boards, that have been providing services, including the FQHCs that are sitting right on the screen in front of me this morning, and that do a really good job. Then you have the services that actually the state runs and pays for, you know, our Washington Heights community services and inpatient unit. And then we have New York Presbyterian. And everybody tries hard, everybody does good things, and there are always some new and innovative programs. But for the average person, including myself, when we go to find care, we often can't, even though these services exist. And one of the things we'd like to do by bringing these organizations together in a more robust manner is make no door the wrong door, so that there would be actual referrals between them, sharing of information, and really it would appear seamless, and it would be a seamless experience for the families living in the community, from the elderly really to young people. One of the things the state is going to be doing is making available to your licensed mental health and addiction organizations that currently exist, they're going to be giving them online trainings around dealing with PTSD, grief. And so that will be rolled out, we expect, in the coming months. But they're not going to put their arms around this particular community and say, we can work together better. Everybody always wants to, but it's hard to do. We think we can make progress in that way. I think the other thing is the community organizations, including the churches in the community, are a great source of information and comfort, particularly with the grief that people are dealing with. And I think, again, the state plans on making some online resources available to them and all the citizens in New York State. We want to actually get involved with some of those premier organizations and make sure they too can make referrals that are necessary and needed, so they don't hit a brick wall when they're trying to get help for someone. And the next part is something Dr. Lantigua has been doing, the FQHCs have been doing, which is offering mental health and addiction screening and short-term treatment right within primary care. Well, you have primary care practices that don't have the wherewithal to do that. What we'd like to do is make psychiatric consultation available to them as they do screenings and identify people from the faculty at Columbia and do that virtually, because a lot of treatment is now going on virtually. And in addition to that, take this behavioral health core that we're discussing and train them really to be care managers. One of the things I'm personally very passionate about is that the behavioral health core, which our community members, have a career path. And I've seen it done in other places where people are able to move on then to college, to professional degrees, to nursing, and really, you know, to gain the hands-on experience. And we would help them along that career path. So those are the pieces, and that's the reason for this, is trying to give back in many ways. You know, Columbia is a big piece of that community, and I think we have to be good neighbors and give support where we can. And so we're very excited about the possibility of doing more and being an even better resource. So I'd love to hear your thoughts and your questions, as I'm sure would Harold.
Well, let me just open it up by saying that the expansion of mental health services in the community has been the #1 budget priority of this committee and the community board, I believe, for the last at least 2 years. So we absolutely would welcome any additional services coming into the community, and especially from the medical center with your expertise, and certainly the idea of linkages, strengthening the linkages with existing CBOs. It makes a lot of sense. And I have when do you expect to be able to launch this initiative? And is this dependent upon your getting funding, or is the funding already in place? How would you pay for the behavioral health core, among other things?
It is dependent upon our getting funding, and we have not gotten funding. We're looking at both government, but we're also looking at private philanthropy. You know, we really have begun reaching out to foundations as well. There are foundations certainly in the city. So this, you know, we are thinking about a 3-year project. Hopefully the pieces that really do make a difference could continue. Some of it could be billable in insurance, but we're just at a beginning stage. And so what we may need from you is help as the city and the state look towards funding they're going to get to deal with COVID-19, that some of it be allocated to the projects we've described. I think the other thing that I'm just beginning to think about really, and actually talk with Dr. Lieberman about this morning, is I think we can expect, as the fall ends and winter begins, to perhaps have a resurgence. You know, we have enough problems now with the 20 to 29-year-olds hanging out in the street. Well, when people start having to be indoors, will we see, you know, a real spike? And, you know, how much can people tolerate? Most people will do okay with just a little support and help. But when you look at people my age, actually, and the kind of high-risk groups, you know, people who have comorbid physical illnesses, people over 60, I mean, you have people in the community who will get increasingly frightened if this happens in the fall and there's another spike. And I think we have to be there for them.
All right. Well, I think I'm not going too far out on a limb by saying that the community board would welcome the opportunity to work with you to make this a reality. Let me ask you, you used some abbreviation earlier. Did you say FQHC? Was that the abbreviation?
Federally Qualified Health Center, but Brian and his colleague can certainly explain what that is.
Oh, okay. All right. You have to excuse us. We don't know all the lingo.
No, and I try not to use lingo, but you know, we always fall back into our lingo.
All right. And actually, I am hoping that that we can establish some cooperative arrangement between you and the Ryan Health Center. I'm going to have the Ryan Health Center make a presentation next, so maybe you guys can hang around for it.
Yeah, I'd love to.
And
right,
by the way, we also, I mean, you know, we've laid out kind of an outline of what we think makes sense, but we definitely want to engage the community in further refining that.
All right, very good. Maybe we could have a sit down at some point and go through it in more detail. Any questions from all committee members? Sally, I know you have a question. Catherine, go ahead.
Hi, everyone. I had 2 things. One, I know, will there be partnership with NYP Queens in terms of this project? And I might have missed it, but is there a larger research component to it as well?
I'll let Harold answer the research piece of it because he is our research guru.
So on the research side, yes, the idea would be that it would not be sort of research, traditional research, but it would be research that is part of a continuously evaluating process to understand whether the innovations that we're implementing as part of this are working, and if they're not working as well as we think, is there a way to improve them? So it's a continuous improvement model that involves research, but also documenting the success and actually promulgating what we've learned to be disseminated much more broadly.
And I can talk a little bit about the Queens issue. You know, we've been focused obviously on Washington Heights and Inwood. It's an area dear and close to my heart. I grew up in the Marble Hill Projects, actually, spent a lot of time in Inwood. So although I haven't been back in a long time, I feel quite connected to it. I know Queens has been very heavily hit. And I was in Elmhurst recently, at Elmhurst, the city hospital, and they really were devastated at one point. We're not looking at that right now, but it doesn't mean that couldn't happen. I think we have to be respectful of the organizations that exist in those communities and their ability and interest to come together. We'd love to have other groups want to do that in other neighborhoods, and we'd be more than happy, you know, to cooperate and work with them.
Well, if this model works, hopefully it can be replicated elsewhere.
Harold,
Dr. Lantigua, I did not recognize you. Okay, you can speak.
thank you, Chairman. Just to let you know that this initiative is being built to serve 4 contiguous neighborhoods: East Harlem, Mexican Americans and Puerto Ricans, Harlem, African American, the West Bronx, many Dominicans and Puerto Ricans, and Northern Manhattan. It's part of an initiative that we started, and we is Congressman Espaillat, Josh Acosta, who is a trustee at Columbia, Yulisa Reynoso, who is a trustee at NYP and Columbia, and myself, among others. And this initiative is called now the Northern Manhattan, the West Bronx Vanguard. And again, it's been presented this week, and we have presented already to some of the elected officials in Harlem. And next week is going to be presented to the Great Harlem Chamber of Commerce. I have been discussed also with elected officials in the Bronx, and Peter Pichardo, Senator Cabrera, and others are members of this group.
All right, so it's a much larger catchment area. Goes and includes all of Harlem and parts of the West Bronx.
Correct.
Right?
Yes.
Okay. All right. Very good. All right. So basically, the congressional district, the 13th congressional district.
Part of the 13. Those includes the Northern Bronx, which is at Montefiore and those areas.
Okay. All right. All right. Okay. Thank you for that. Now, what we have in the community, we have, I don't know if Fountain House is one of the organizations that you're thinking of reaching out to. Fountain House has a residence on Amsterdam Avenue between 172nd and 173rd. I don't know that they provide any direct service in the community, but this is an organization that you might want to also consider when you're doing linkages to groups in the community.
I know them well.
And also,
Okay.
Dr. Vassan is on your faculty. I mean, he's someone you should definitely be talking to.
All right, because I would like to see them get more involved in our community, and maybe this is one way to bring them in. And certainly this is definitely an organization that has years of expertise
Decades.
decades of expertise dealing with mental health issues. So I'm saying that, Sally, because I'm preempting you because I expected you to say it. Any other questions or comments? Sally.
Yeah, this all sounds great, and I'm really glad you're working on it. My concern is that in the New York Presbyterian system, it looks like we're down now 80 beds. So, well, I wonder how we're going to address the needs of the seriously mentally ill, both in our neighborhood with the failure to reopen, I guess, Allen, but also what's going on at Brooklyn Methodist. And while I think this is a great need, I think that those with serious mental illness have sort of been left out of the equation. So just a comment.
Well, I can't speak to any of the inpatient facilities in terms of New York Presbyterian, but certainly we would not be excluding people with serious mental illness. In fact, those are the people who are in some ways most at risk.
Right.
So we would want to augment those services and also specifically target those individuals with the serious mental illnesses.
Mhm.
All right, does Tanya have a question?
Yes, I do, Steve. There is a question about, is there a plan to prevent secondary issues such as the multitude of illegal fireworks from adding to the burden borne by communities on top of all the other COVID fallout? So if people like healthcare workers can't sleep, that takes an enormous toll on their mental health. Can some of you speak to that in terms of what's been happening in our community that's been happening right now? Literally, I can tell you this, I did not sleep. I was getting 2 hours of sleep if I was lucky. And this went on for over a month. And I'm actually in an escape apartment, to be honest, in the community, because I cannot live in my own apartment. So I'm thinking about those healthcare workers, those essential workers, and other people who might be suffering from mental health issues, because I've had people contact me and say, I'm a veteran, I have PTSD, and hearing those M80s go off and hearing this is really detrimental to my mental health. So can you all address, like, what is going to be the plan to address those things as well as part of this, and to hold people accountable for doing so?
Actually, let me add something to that question. I'm wondering, would anybody from Columbia be aware of any study that possibly has been done on this particular question as to whether or not persistent, repeated fireworks or noise issues like fireworks could have a serious impact? What kind of serious impact it has on people? Is there a study that might exist that we could look at?
I'm not aware of a specific study looking at that, but there is no question that sleep disruption and poor sleep has a huge effect on the well-being and functioning of individuals, normally, and it's especially significant with people that have had pre-existing behavioral health conditions. So you're right. You're absolutely right that that's a sort of a widely, trivialized, not recognized as an important contributor to the, basic well-being of individuals. We're not, I don't think we have the capacity in this initiative to say we're going to interrupt fireworks. But you're absolutely right that that's something that really needs to be addressed.
Can we address it as noise pollution as a public health issue? Is there a way that you all could partner with us to actually address that? And that we can do. We can at least look at it from that angle. No, we're not going to solve fireworks, but we can actually advocate for on behalf of this being a public health issue. Sorry.
It absolutely is a public health issue.
I also wonder if we can just get information out. Y'all have a lot of resources for veterans. You have PTSD studies going on. I just think if there's a way to communicate to the community board so we can get that information out, because there are resources that our community isn't aware of in terms of help, especially for PTSD. Y'all are doing a lot of good work in that area.
Absolutely.
How would we address it as a public health issue? I just feel like a lot of times these things come up, and I'm not trying to interrupt, but I just feel like a lot of times these things come up and we just go right past it, just like we did just now. We have people right now suffering in our community because of these issues. What can we do? How can we make it clear that this is a public health issue? What is going to be done? And how can Columbia help us, NYP help us make this be clear that this is a public health issue, and partner with us and doing something and addressing that as a public health issue?
Tanya, this is Sandra. One of the things that we can do is reach out to our School of Public Health, because this is one area where we can partner with them to work with the board on addressing this. And this is something that we've done in the past, and we can connect the right people at our School of Public Health to work with you on this.
Yeah, I think that would be very useful, because I think we can we need some kind of backup in order to really send the message that this issue has got to be taken more seriously. So,
Dr. Lantigua had something to say. He was trying to speak, Steve. I just wanted to let you know that.
I just want to say that if you address this issue to the environmental department of the School of Public Health, if they don't have and they don't know the data, this is a good subject to do research on this subject, in that they can have some students, some faculty members that have experience to really come up with an answer to you. But I would say that for the committee to address a letter to the afraid and to the chair of the environmental department, and I'm sure they will have a lot of interest to come back with an answer if they don't know the answer, to say let's look into the issue.
all right, no, that's a good suggestion. So we're going to work with you and Sandra on this.
Perfect.
All right, are there?
Steve, I'm sorry, somebody from the public, are we allowing them to ask questions? Somebody wanted to ask a question?
Yeah, I did. 1 second. Catherine, did you have a question as well? Catherine, are you still with us? Am I reading this thing correctly? Daryl, are there 18 questions?
No, there were some we've answered already.
Oh, all right. So is there a new question?
It looks like Fern has a question, and then we can, yeah.
All right. All right. Fern, go ahead.
You're muted, Fern.
Fern?
Okay, fixed.
Okay, go ahead. Go ahead.
So I've been around the world of mental health and the desperate need for mental health services, particularly for older adults, for more than 20 years in this community. And there are less services today than there were 20 years ago. So no matter what, and I love that you want to do this, I think it's awesome. Sustainability is crucial because it's always a funder, it's always a project. It really needs a commitment between the Psychiatric Institute, Presbyterian Hospital, and Columbia to say, with or without the same degree of funding, the commitment is there, and either the services or the partnership in some way will be sustained. Because it's a great idea that you can go in from any door, but the door is closed on the other side. So, you know, there's that memory disorder and dementia and depression doors. But after you go in the door, there are no services. So yeah, great, you figured out what I've got, and then goodbye.
Much
So
of
that's
what we're,
my plea and my comment.
Well, no. Curtis, let Dr. Rosenberg respond.
Certainly.
I'm not a doctor, by the way, but thank you for the honorarium, the honorary title. I think that the issue of sustainability and financing is one I really have some expertise and knowledge about. And most of what we're describing can be covered through people who are both uninsured, commercially insured, have Medicaid, and have Medicare. It's just being able to braid the pieces together. We'll need time to do that and to make a plea and a play for the kind of financing we need, the kind of capitation, subcapitation, case rates. So if we can get 3 years, I think we can have this extended and paid for as part of healthcare, which is what it should be, and how it should be paid for.
But three years sounds so short.
Chairman, in terms of dementia and Alzheimer's disease, we do have capacity. We have the Center of Excellence for Alzheimer's disease with ICOI Direct, with Dr. Honey and Priscilla Viviano. And we have in there social workers, we have nurse practitioners, and we do have capacity to serve this community.
But not the depression side, Dr. Lantigua.
That's true. the student
It's a
movement-
door. It says no barrier. Come in through dementia, come in through depression. But if you're depressed, never mind.
If you are depressed alone, they don't go to, but if you are depressed and demented, yes, we have capacity to do both.
Okay.
Thank
Oh,
you.
gosh. All right, well, that's maybe a distinction that we can try to do without. Any other,
Yeah, I was gonna,
Curtis, I'm sorry, go ahead.
no problem. I see a correlation with public safety also, as we talk about public health, as we talk about public safety, and the issues that we're facing now with noise pollution, uptick in crime, uptick in things like the uses of fireworks. I think some of these things, I'm no social science research, but I've obviously have had experience with research, and I do think that there could be a correlation between some of these byproducts of COVID with some of the things we see in the community right now. And if we can make a case to say that, well, these are also symptoms of COVID. They're not separated from COVID, right? What we're seeing in the community, people hanging outside their apartments, they've been locked up for 3 months. It doesn't make it right, but there's a lot of things that are happening in the community as a byproduct of our quarantine, our confinement, our mental instabilities, and our complete, disregard for others. Right now. So I do think that as we dive deeper into this conversation of researching the impact of COVID and the additional health disparities, not just people of color dying at a higher rate than others, but looking at the disparities with the mental instabilities and the traumatic experiences that has caused so many, and perhaps making that correlation with some of the crime increases we've seen also could be good for us to make a stronger case to have more resources from the city to support some of the crime, some of the initiatives to diminish crime.
Curtis, you are spot on. I was on the phone actually this afternoon with Shirlane McCray, the mayor's wife, who is very committed to mental health as an issue. And she brought up the whole really issue of safety. It hadn't been something we were discussing, and she is thinking about it. So I think your idea of also aligning this with safety issues is a very good one. Thank you for that suggestion. And I love your shirt.
I just want to say for the record, I'm not opposed to people hanging out on the street, but when they're hanging out on the street after midnight, 1, 2, 3 in the morning, and keeping other people awake who are their neighbors, that I think is beyond the pale. So people in our community are welcome to hang out on the street, but there are limits when it comes to affecting how other people can survive in their own apartments and enjoy the use of their apartments. Daryl.
Yeah, no, just from the chat line, also, I just wanted to mention a few things that were said recently. Someone pointing out another intersection at 204 and Post Avenue, where that's been a problem. Also, someone mentioning that talked before about, how the mayor is no help, the police clearly aren't helping, so the enforcement side. But this is clearly a mental health issue as it relates specifically to the fireworks. So
we're gonna have a further discussion specifically about fireworks later on the agenda. Are we gonna be able to refer back to the chat after this meeting, or does the chat disappear?
Well, I think we're trying to say a lot of them on the record, so it's live, but I believe there's a way for Paula to keep that.
All right, I want to make sure that we're taking note of those locations.
Yeah, and then also there's a person named Cruz. I see your question from before, and we can talk about that in new business. Just FYI for that.
All right. Okay, so
somebody else from the group wanted to talk. I don't know if they can unmute them.
I know, but are there any questions now specifically on the Columbia Mental Health Initiative? All right, well, let's move on then. Thank you. It is Dr. Pincus, is it not?
Yes. And
okay, good.
Thank you for having us. We really
okay, well, I'm hoping that we'll have an opportunity to sit down with you on some other occasion, and with you and Ms. Rosenberg, Dr. Lantigua, with Ross, with Sandra, and go into further detail about the program and help you perhaps flesh it out and make it happen. And certainly if you're submitting applications for funding, let us know if we can provide any letters of support or do anything we can to be helpful.
Thanks so much. We really appreciate it.
All right. All right. Do we still have the Ryan Health Center?
Yes, we do.
Yes.
All right, very good. Michael, you're gonna handle the PowerPoint, and Brian and Samuel are gonna do the presentation?
That's correct.
All right, very good. I'm very happy to welcome the Ryan Health Center, the William F. Ryan Community Health Center to Washington Heights. This is the Ryan Health Center has a number of facilities, began on the Upper West Side, is also located on the Lower West Side and on the Lower East Side, and is now venturing into Washington Heights to expand its it has an excellent reputation for providing health care, and this is a very exciting development to advance health care, the availability of health care to residents of Washington Heights and Inwood. So I'm very happy to welcome you. Mr. McIndoe, you're the president and CEO.
Yes.
Thank you so much for deciding to come to Washington Heights.
You're welcome, and it's our pleasure. First, let me just thank the Health and Environment Committee for allowing us to do a presentation tonight. We are pretty excited about the site that we're going to be opening up in September. Before I go in, I'd like to give a little background on Ryan Health. And before I do that, I know it was a question a minute ago. Basically, we are a federally qualified health center. And what that means is we are a community-based healthcare provider that receives funding from the federal government to provide primary care services in underserved areas. And part of that requirement of getting the dollars from the federal government is that we can never turn a patient away. Any patient that walks through our door, it doesn't matter whether they have insurance or not have insurance, they must be seen. And I'll get into that in a second, that was our founding principle many, many years ago. So as I mentioned, we have over 50 years of delivering high quality, affordable, comprehensive health services. So we are more than primary care. We have, besides primary care, we have dental service, vision services, and we have a number of specialty services also throughout the network, whether it's cardiology, podiatry, dermatology, just to name a few. So we do provide a lot of specialty services besides the primary care services. And we actually have internal medicine residency programs that we also run throughout the network. As the chairman said, we are located in Manhattan, specifically from the Lower East Side. Currently, we go as far north as Harlem. We have two small sites in Harlem. Hopefully within the next 2 months, we will be going further north up into Washington Heights, Inwood area. But we do have 18 sites throughout the Ryan network. We do have 7 school-based health centers, and we have 4 homeless shelters that we do provide services for. And we also have a mobile health center. And actually, the mobile health center actually this week was up in Inwood providing services. And what they're focusing on right now is doing antibody testing for COVID-19. So we were actually in Inwood on Monday and yesterday. Didn't see that many patients, but we have to build it up. But it's a start. I mentioned a little bit ago, our founding principle is healthcare is a right, not a privilege. And this was first articulated by Congressman William F. Ryan, who obviously we are named after. We live that every day, and that goes back to every person that comes into the center needs to be treated with respect and dignity. And it doesn't matter race, whether what kind of whether they have insurance or not. They should be treated with that dignity and respect that we all deserve.
Okay, I have to stop you for a moment and provide a little more background, because there are some of us who remember Congressman Ryan with an enormous amount of respect. And we remember how he served our area. Washington Heights and Inwood was part of his congressional district from 1961 to 1972. He was considered like the conscience of the Congress. He was one of the leading opponents of the Vietnam War. He was an important advocate for civil rights. He was also a champion of the national park system, by the way, but he was a very significant and important leading voice in Congress. And we were very proud to have Ryan as our congressman, and very proud to have a facility now in our district named after him.
Yeah, Steve, on a side note, his son is still involved to a degree. He lives down in Washington, D.C. He's an attorney. And actually, we got a small check the other day because he's 40 years in one organization, and the organization sent to William F. Ryan a check of $5,000. I think we got it last week. So there's still a connection to the Ryan family.
Very good.
Michael, could you change the slide, please? So about a year and a half, 2 years ago, we conducted an external needs assessment because we are in an expansion mode, and we said, we wanted to go further north into Manhattan, and the needs assessment found that the greatest need was in the Washington Heights and Inwood area, had the greatest unmet need for healthcare in Manhattan. The rates of many diseases, you can see diabetes, cardiovascular, cancer, were disproportionately high from the rest of the city. And even hospitalizations relating to those diseases were also disproportionately high. So when we looked at it, it really popped out at us when we had the consultants come in and really look at it, that this is an area that that FQHC should be in, so that we can provide the services that your community needs. And as I mentioned, average income is also 40% below the borough-wide average. In 2019, to just give you an idea, we did service over 50,000 patients throughout New York City, and about 70% of them had Medicaid and or Medicare, and about 12% were uninsured. So that gives you the idea that the majority of our patients are either uninsured or underinsured that we mainly provide services for. So with that, I'm going to turn it over to Sam Bartels, who is the executive director of our West 97th Street site, which is the largest site throughout the network and the oldest site. And Sam has been taking the lead in setting up the operations of the new site. So Sam, if you don't mind.
Hi, everyone. Thank you for having us. I'm going to cover 4 areas: the location, the timing, which is the reopening, and the details of the practice, and the staffing. So we will be located on 150 Wadsworth Avenue, right at the corner of 181st Street and Wadsworth. We considered many options, and we chose this site as it was centrally located. We are preserving the building stock. Apparently this was an old theater in the community. So we are preserving the old theater with a long history in the community. It's also an easy access to public transportation, multiple bus lines, including the one which stops right in front of the center, and also 1 and 8 subway lines nearby. In terms of timing, we're anticipating finishing construction in August and begin seeing patients in September, pending Department of Health approval, which we already in the process of getting the CON process in the process of obtaining the CON. The center itself, we are really excited because this is our newest center, and it's going to be 7 exam rooms and around 2,700 square feet. By year 2, we expect to serve nearly 3,500 unique patients, equaling over 14,000 visits. The services will be adult medicine, servicing children, adults, seniors. And as part of the primary care, we're also going to have behavioral services, which is available to those who need it. Specialty care will be added based on need, based on patient needs. Staffing wise, when we're fully operational, we're going to have 18 staff at the center. 11 or more of them will be 1199 SEIU members. And we also made it a priority to make sure that we have bilingual staff at this center. It's also going to be one of our most high-tech, advanced, and one of the most brand new center and gonna have self-check-in, electronic check-in kiosks. We're exploring online scheduling, many amenities to make the patient feel welcome and also make the ease of access much better for the patients.
So Steve, we'd love to open up for discussions. As Sam said, we are on target. We're hoping to open by mid to late September to have our opening, to open up the site. One of the things that we were fortunate is during the COVID crisis, during the pandemic, we were considered essential services, so the construction was not delayed. They could continue constructing the facility. So that was helpful to keep things moving along and on schedule.
Oh, very good. Is it more than one floor?
No, it's one floor.
Really? Oh,
Yes.
okay. So, okay, I
And
thought maybe,
it's about 2,700 square feet.
okay, I thought maybe the theater had a balcony or something. Is there a, what do you use? Do you have to have a backup hospital? Is there a backup hospital?
Yes, we are working with Presby to have the agreements in place. I think it's pretty far along right now to have the agreements in place, because that is one of the requirements, that we have to have a backup hospital agreement. Yes.
And so you're expecting to use Presby?
Yes.
Oh, all right, very good. All right, are there any other questions from the committee members? Daryl, do we have anything from the public?
Well, we might. Yeah, let me check. But I did have a couple questions. Was there any? Did you have any focus planned for the neighborhood? I know there's been a growing LGBTQ community up here. I know you do a lot of that in your Hell's Kitchen branch, and then also in terms of like family planning services, there's higher numbers of teenage pregnancies in this neighborhood as well. So I just wonder if you had any.
Yeah, right now, we do, Daryl, we do a lot of community events, and a lot of that is around LGBT. So we do a lot of that in the community. As I mentioned, we do have a mobile van that will be up in the community as needed. It can go anywhere in Manhattan, and actually in the Bronx also. It can really anywhere in the city, but we focus on Manhattan. So we will do community events throughout once we're up there, and we've actually talked to all the elected officials, staff, about how we can be in the community and helping out, and hopefully we'll get some feedback, and and then we can, as I said, be in the community. As far as the family planning, we right now our family planning largest site is down in the Upper West Side. It's a very large family planning it's called Orion Health Women's and Children's Center. And one of the things that in the beginning that we're going to be evaluating is what the needs are. So if that is one of the needs, and it sounds like it may be, we can pivot pretty quickly and provide services as needed. We have 7 exam rooms, so we can, it's not which is a small site by standards, but we can pivot if that's a need, and have a provider up there that can provide those services. We're going to be, and Sam mentioned earlier, same thing with specialists. We're going to evaluate what the needs are, and then if the needs is for a certain specialty, and maybe it's 1 or 2 days a week, that's what we're going to be. That's what we would start to provide. So any input you have is definitely helpful to us.
Thank you.
All right. Any other questions?
I do. I just wanted to know if you are planning any special services for the older adults in the community.
Betty, do you want to identify yourself so they know?
Betty Lane, and I work at Isabella, which is at 191st Street and Audubon Avenue, and we provide a number of services in the community for older adults. One of the things that we do know is that there's a scarcity of mental health services and physical health services for the elderly. It's not easy to access for all of them, and I'm just wondering if you have any plans to focus on that particular population. I know you're planning on doing a survey, but I'm wondering if you have anything, at least from the start, along those lines.
Yeah. Actually, two things. First, our primary care docs will be serving the elderly population as part of their part of their services. We also are going to have a social worker at the site, so that we will be able to provide some behavioral health services. And again, as we see what the needs are of the community, and it sounds like from the presentation we heard earlier, that may be a significant need that we, and actually, who brought that up to us was Assemblywoman
De La Rosa.
Yeah, Assemblywoman, I'm sorry, De La Rosa was quite adamant about the needs in the mental health services. So we can pivot, for lack of a better word, to whatever the needs are. Again, within our confines that we don't, like I said, we only have 7 exam rooms at this point.
All right, anyone else? Oh, all right, very good. All right, so I hope, I assume maybe there'll be an open house in September?
Yeah, go ahead, Michael.
Yes, that's our plan, Steve. And we definitely want the community board to be present. And we would definitely appreciate any help that the community board can provide in spreading the word about the opening of the center.
Right. Well, you'll send us a flyer that we can send out, to our email list and circulate to others and make sure the word gets around. So again, we certainly welcome you to the community, and we certainly want to be supportive and make sure that you succeed. And because what you're doing is absolutely beneficial and a major plus for the community. So thank you for making this investment in Washington Heights and Inwood.
Yes.
Ms. Hertzberg.
Yes.
Do you want to mention that your senior center is going to be located only a few blocks away from their health center? Would you
Thank
want
you
to?
so much, Steve.
Would you want to?
We're actually going to be at the intersection of Audubon and 181st.
Okay, okay, they may not know the terrain yet, so maybe you want to tell them that's like 3 blocks to the east.
Yeah, not even 3. It's really 2 blocks to the east.
Okay.
And we're already a very big established senior center in the area. So I think that we should get to know each other.
Fantastic, absolutely. Steve, one of our biggest hopes is that this will be so successful that we're going to be looking within the next couple of years for another site in the area.
Well, I think there's room for a 2nd floor. So maybe maybe you can.
There was no balcony.
No balcony. All right. Well, let me tell you something. By the time I was around in that neighborhood, it was a porn theater. So it shows you that I never went in there. Okay.
Thank you again for having us. We appreciate it.
Well, thank you for coming to Washington Heights, and we look forward to a long relationship.
Yes. Thank you.
And if Presbyterian doesn't sign that backup agreement, let us know. And our next speaker, Natalie, do you have a comment? Natalie?
Yes, no, thank you for the presentation. When you folks joined us at the Borough President's office to do this, we did discuss some local CBOs like the 2 senior centers. I just wanted to reiterate the single women's shelter on Audubon right there, and the PS 132 about a block from where you are setting up your shop now, which is a community renewal school that is high need for both the students and the families there. Also where I started my distinguished education back in 1970. So please, it's a great neighborhood. Welcome. Count on us for support.
Thank you.
Thank you. Appreciate it.
All right. Very good. All right. Thank you. And our next speaker is actually from New York Presbyterian Hospital, the Director of Community Affairs, Julio Batista.
Thank you, Steve. I'd like to also echo Natalie's sentiment there and welcome the Ryan Center to Washington Heights. It's a great community, and so thank you. It's much needed services there. So I'd just like to mention that, you know, the hospital neuroperception remains focused on being ready. So readiness is really important part of this, of our thinking. Not sure whether in fact we'll have a second resurgence coming up in the fall. Obviously with, you know, being the same time with the flu season, it's gonna get pretty intense, I believe, because, you know, a lot of people get the flu and think they're, you know, they have COVID. So it is going to be quite interesting time come the fall. So one of the things that I want to present here, and I'm sorry if some of you already saw this, is really we produce a very brief, close to 4-minute educational video around the use of telemedicine, telehealth. And the reason we want to show it is because, you know, there's, you know, as we wanted people not to enter the hospital, we wanted to also give the opportunity to inform the community that, you know, they could still reach their doctors through their phones. So we think that that's going to be something that will continue. Our ACN has seen from March 1st through the end of April, really double their the intake with telemedicine. They had over 40,000 calls on telemedicine. So we felt that it's important for us to produce and disseminate as wide as we can a video that would at least educate our community around telehealth. So if you bear with me for a second, I want to be able to just show that to you.
Tell me one more time, what was the period that in which the ACN had to double its normal intake?
So that was from March 1st through May 31st.
Okay.
Yeah. So I don't know if anybody can see this, the screen.
Yes.
Okay, so it's a very short video.
All right. All right, we need the sound. Oh, shoot.
Julio, you might have to adjust the audio settings on your side.
I'm sorry?
Yeah, we
don't hear the video.
You didn't hear the audio?
No.
Hmm. You don't hear that at all?
No. We can see, we can read, but we can't hear.
Yeah,
Can you email it to Paula, maybe?
Sure. What this is actually both in English and Spanish. So what I'll do is I'll email that to Steve and Paola, and maybe you could disseminate that to committee members and folks who are also here on the line.
You can also put it on the questions and answers, so other people outside, they can get it through that link. Like the people that are not panelists can get it now through there.
They'll get it as well. Okay.
Yeah, thank you.
So Julio can do that from his end?
Yeah.
Okay.
And also, Julio, you can try doing it again if you want. You can stop the video and kind of like relaunch it and see if it gets you an option. Because if we can hear you through the laptop, then it has to be your video, like the actual video has to be muted because we can hear you.
Okay. I don't know if are you able to see it there?
Yeah, we can see.
I mean, can you hear it?
No.
No,
not yet.
Okay.
Can you hear it on your side, Julio?
Yeah, I just took it off. So I can hear it, but for some reason I'm not sure why you couldn't hear it.
Okay. All right.
So oops. So what I'll do is can you hear me?
Yeah. Yes, we can hear you.
Yeah, we can hear you. Yeah.
Okay. So what I'll do is I'll share the video with everyone, and I'll also make sure that we'll send the English and Spanish versions, just in case you want to be
All
able
right.
to share that with some of the
All right,
folks as well.
okay, we can try to show it again in September.
Sure, and I think, the purpose of it really was to start that discussion around it. So we will be more than happy to have Dr. Minguez come to the September meeting and provide a little bit more information around telehealth and what are we doing around encouraging people to actually use it.
All right, so we'll mark that down for September as well.
Sure. And my apologies, I don't know what happened. You can't get the sound.
Yeah. All right, well, we'd rather have Dr. Minguez in person anyway.
Oh, excuse me. Okay.
All right, do you have more to the report?
Well, that's really just want to be able to show that video. Wanted to emphasize the fact that, we need to, as a community and as a hospital, be ready in case there is a second surge. And, we're obviously getting, doing all we can to ensure that the hospital is ready should that happen.
All right. Yeah, you were able to get some of the statistics that I requested or not?
Well, right now, in terms of COVID, the stats that we have is really within our hospital up in Northern Manhattan, which Allen, Tony, and of course, the Allen Hospital. We do have 74 inpatient COVID currently. So those numbers are, continuing to go down. So that's the number that we have right now, is 74 patients.
74 in Choney, Milstein, and up at Allen.
Correct. That's a combination of all three.
Right.
Yeah. Okay.
All righty.
Steve, do you mind if I just add something to what Julio's saying?
But Mr. Fromer?
Yes, thank you. Obviously, working with the hospital, telemedicine has been a huge part of what we've been doing over the last 4 months. Prior to March 1st, there were significant legal and regulatory barriers on both the federal and state level to widespread use of telemedicine, either through legislation or through emergency declarations on the federal or state level. A lot of those barriers were lowered, thus enabling the growth of telemedicine. And I think that's one area where we're not going back from. Telemedicine is here to stay. You've seen the tremendous benefits from it, but one of the challenges is to make some of these, the advances that we've made in terms of lowering these regulatory barriers extend beyond the emergency. Whether it's something called site origin or payment or even licensing issues. One of the things we've learned in telemedicine for jurisdictional purposes, it doesn't matter where the where the doctor is, it's where the patient is. So the doctor could be in New York, fully qualified, fantastic in his or her field. If the patient happens to be in Pennsylvania during the telemedicine visit, that doctor can be accused of practicing without a license in Pennsylvania, even though the doctor never set foot in Pennsylvania. So what's one of the great sort of regulatory challenges that we need? I mean, we at the medical center, while most of our patients come from New York, we do get a large chunk of patients from New Jersey and Connecticut. It's a big issue for student health. Colleges, people who grew up in New York, students may go to school out of state. Without this issue, they can't have continuity of care. So just, adding to what Julio said, one of the policy challenges that we have over the next couple of months is creating a playing field, if you will, reducing these regulatory barriers to the increased use of telemedicine, because everything right now is on an emergency basis, and we need to extend that beyond the emergency.
And Ross, just to be clear too, because you used the example of someone from Pennsylvania, are you talking about a Pennsylvania resident or a New Yorker who's just in the Poconos for the weekend?
Doesn't matter.
Is there a difference?
No. So one thing,
in that scenario,
most people say that one visit, sort of emergency phone call, is not going to cause you a problem. But any sort of extended continuous care, you have that second phone call, you are risking being accused of practicing without a license. And it does not matter whether the patient lives in Pennsylvania or just happens to be visiting relatives for the weekend in college in Pennsylvania. The jurisdiction for licensing purposes depends on where the patient is physically located, not where the practitioner is physically located.
Do you have to take special precautions to make sure that nobody on the outside can like hack into the call and protect the privacy of the patient?
And absolutely, and the systems that we and York Presbyterian uses are fully compliant, fully HIPAA compliant, and your privacy is protected.
Yeah.
In fact, you know, I was overheard one of our faculty members, the biggest challenges that we face is not the technological challenges, but the physical challenges. He saw a patient who decided to take the session from Trader Joe's. So the patient was in a public setting during this telemedicine visit. And that was the risk to the breach of privacy, not anything having to do with the technology.
Sally,
is
you
there
have a question?
legislation in the works?
So there's a number of things that we're going on. First of all, one of the things that the legislation the governor has already done is included audio only in telemedicine, which wasn't before. You can now, prior to this, a telemedicine visit had to be video. And there are a number of folks who frankly don't have that technological basic capability. Governor signed legislation allowing for audio only televisits. We suspect that over the next couple of months, you're going to see an effort in Washington on the federal level. We are starting to have some conversations with folks in Albany about it as well. Again, this licensing issue is one that probably needs to be handled on a state level. The issues of payment and these companies called site origin is more of a federal issue.
All right, Sally, you have a question or a comment?
Yeah, my question with telemedicine is how do the reimbursement rates for Medicare differ for an office visit, like a new office visit that is telemedicine versus in-person, and also for commercial insurance? What's the difference in billing?
So I'm not an expert on this, so take my answer, as you should always take my answers, with a grain of salt. But as I understand it, prior to March 1st, or roughly March 1st, the reimbursement for telemedicine was either non-existent or significantly less than an in-person visit. When I've talked about the regulatory release is now, because of these emergency declarations, oftentimes the reimbursement is on par with an in-person visit. And again, that is one of the things we would like to be seen. If a physician or a doctor or a nurse is providing 15 minutes worth of, or half an hour's worth of mental health counseling, which in person or on the phone, the reimbursement should be the same. There certainly should be no financial disincentive to using telemedicine. It was mentioned, I saw on the screen in the video, there are tremendous advantages to using telemedicine, and we certainly don't want to provide a financial disincentive to do so. But that's one of the things, Sally, which have been covered by these emergency regulations, for lack of a better term.
Great, thank you.
All right, any other questions now? All right, let's proceed to the report from Isabella Geriatric Center.
Wait,
Betty?
Steve, I did have a question, not on telemedicine.
Well, go ahead.
Yeah, could you provide an update on what's going on in Allen? I know we're going to hear from the nurses later, but we would like to hear from your perspective, and also the loss of 50 beds at Brooklyn Methodist. I know that that's not in our geographic area, but that is capacity that has been lost. So if you could just update us on inpatient capacity.
I can speak to the Allen, and again, I think that I'll repeat what we mentioned the last time, is that we don't know what the future holds. So when the surge originally occurred, that psych unit was closed. Patients that needed to be serviced were sent down to Gracie Square, which is a hospital on 70th Street, which is affiliated with us. At this point, we, as I mentioned, continue to stand, just getting ready. There's a second surge. So there is no, to Monsanto at this point, to be able to put that psych unit back to what it was in the near future until we figure out what's going to happen in the future with COVID.
And are you able to handle the capacity at Gracie Square? What is your census now at Gracie Square?
Well, I don't have the census figures, but I could certainly, be able to get that and share with you.
That would be great.
But I'd just like to add that, in addition to Gracie Square, we do have, the Westchester Division, we do have a wide array of different locations where patients can also be served. So, but I'll get you the census in terms of, what it is at Gracie Square.
Perfect, thank you.
Well, it is a matter of concern that the inpatient capacity is continuing to decline throughout the system. And it would be useful to know what the situation is at Gracie Square, but as you know, Julio, it's not acceptable to us that this unit is closed and we have no idea when it will ever reopen.
I understand that. I understand those concerns, Steve, but I think at the same token, I think we also have to understand that we don't know what's going to happen, come September, October. And
I know,
I gather when that time comes, we'll have a better understanding.
I know, but you still have the field hospital. You still have, and every other unit that was moved out of Allen has been returned, and it's strange that this is the one unit that is still in limbo, and we have no idea if and when it will ever come back. And it's disturbing to me that the hospital doesn't at least say that at some point it will definitely come back. It just seems to be an amorphous situation.
Mm-hmm. Understood.
All right. Betty Lehman, report from Isabella. Hold it. We have two hands. Whose hands are these? Oh, Chris, did you want to say something? Chris Trin? Are you with us?
I don't think they can talk, Steve, is the problem.
He should be a panelist.
Oh, okay. Then maybe Paula could promote him.
And so can Daryl and Steve, you guys, all that, when you catch them, just swing them over and promote them to panelists because they were not on the list of names that Steve gave me earlier.
Oh, what?
Like if you guys recognize the names.
Well, if he's raising.
Hello?
He's on now.
Hi, good afternoon. Chris Trin, I'm one of the psych nurses at the Allen Hospital.
Hello?
Can you speak up a little?
Hello, I'm Christopher Trin. I'm one of the Allen psych nurses. And I was one of the nurses that was sent to actually Gracie Square to handle the COVID situation. So I'll be talking about that more, but I heard you guys talking about, the nurses moving to Gracie Square. Yeah, I was sent down to Gracie Square. I was placed on the COVID unit. So I believe hello, can you hear me?
No, why is the volume so low? Paola?
Hello, can you hear me now?
Yes.
Steve, that's nothing that I can control. That's a device that the person is calling in. Unfortunately, yeah, I cannot fix that. I can only fix the volume for the person speaking.
Can you guys hear me now?
Yes. Oh, yeah. Very good. Yeah,
Okay.
Go ahead.
Sorry about that. It must have kicked into Bluetooth. Yeah, my name is Christopher. I'm one of the psych nurses from the Allen Hospital. I was there for about 12 years. I'll be talking about it further, but I was moved from Allen Hospital to Gracie Square, and I was placed on the COVID unit for a while. At max capacity, when I was at Gracie Square, we had about 16 patients. I was there, and then they finally, they teetered down to 0. I was floating back and forth throughout the floors of Gracie. It was an interesting experience to help out with, Gracie and stuff. But yeah, we were just randomly closed out of the Allen, asked to move out within a week to Gracie, which was, not most convenient, but we did.
I'm sorry, you're saying that the number of psych patients was reduced to 0?
Well, the COVID patients went from probably 16. They had a whole floor. It was started off, maybe 2, 3, 4, and then it went up to 16 max.
Okay.
And it's trended slowly down to 0.
But how many psych patients were at Gracie Square?
Gracie Square is fully psych, so it was all psych patients.
And how many would that be?
Fully psych, I'd say they have maybe about like 25 per floor, but they had 4 floors. However, they closed 1 floor.
Chris, I can speak to this too,
Yes.
if
That's
it's all
what-
right, if I butt in. My name's Alana. I'm also a nurse on Three River East at the Allen Hospital. I was also put in Gracie Square. Right now, I've been speaking to several nurses who are still at Gracie Square. There are 4 floors. 3 of the floors are open. 1 of them has been closed seemingly indefinitely. We initially heard July. Now we're hearing September. That in addition to the 2 Methodist units closed down, and of course Allen. But what the other concerning piece here is that since COVID is still an active threat, you can't have as many patients on a unit. You can't have full census on a unit. So even if there are 30 beds on a unit, some rooms can only, that used to house 2 patients, can only have 1 patient. So if you can put them 6 feet apart, you can have 2 patients in that room. But now the issue is that we have way more single rooms just out of safety precautions. So there's far fewer single beds or far fewer psych beds.
But Alana, my concern would be whether or not the, it was down to maybe 22 or 25 beds at Allen at one, most recently, whether or not the people who would normally be served at Allen are they in fact at least now being accommodated at Gracie Square? Are those 22, 25 patients, at least half of whom, maybe more, are coming from Northern Manhattan? Are they now at least being served at Gracie Square, or are they being sent elsewhere?
Actually, Gracie Square, since they are a standalone psych hospital, has the ability to deny patients access, whereas at NYP as a full hospital, I believe like Article 31 hospital, you can't turn patients away unless you really don't have the capacity, but they can based on any status they choose. So my answer is, like, I have seen when we were at Gracie still, I have seen our patients there, but we had to discharge our patients very quickly in mid-March. And so I do think that there's a significant portion of the patients that we would normally see who aren't getting help at all and have nowhere to go. And that overflow usually goes to shelters. We're seeing much more people in the streets and living in the subways. And we're also seeing this is anecdotal, this last part, but from my friends who work in corrections, we are seeing an increase in people with mental illness being sent to corrections as the overflow.
Well, okay, as long as we have the 2 of you on board at this point, Betty, I'm going to push you off for another few minutes. So Alana and Chris, do you have anything more that you wanted to tell us about the situation with the Allen Psych unit?
And also Julia's on the call.
Okay, but Julia doesn't want to speak.
Yeah.
I don't need to speak. The nurses are there to speak. Thanks. I'll be here.
Right.
Okay.
So,
Should I give a brief history? Should I start? Should we start our?
yeah.
No, we know the history.
Okay.
Okay.
But there might be people on the call that could actually find that useful. So can
Okay. All right. Okay. You're right. I take it back.
No problem. So my name is Chris. I'm one of the nurses here at the Allen Hospital. I've been a psych nurse at the Allen for about 8 years, altogether 12 years. Allen Hospital psych unit is called Three River East. We're adult inpatient psychiatry with 30 beds. It slowly trended down because they couldn't find doctors to provide coverage. And that's the reason why they kind of downgrade from 30 down to 22 and slowly, nobody wants to work at a place that, NYP is trying to close. So they've been having a hard time hiring doctors, I feel. So a majority of the patients come from this community. They live in Inwood, they live in Upper Manhattan, they live around the hospital. A lot of them come from underprivileged, little to no income. They're homeless, they have Medicaid, they live in the underserved areas. So they need that support and mental health services. In 2018, we came to you guys definitely helped us. The community board definitely helped us in supporting the unit, getting it stopped from closing. The unanimously vote helped out tremendously. We came together with politicians, the community board, and it ultimately worked for preventing from the Allen Hospital from closing, and it was victorious up until till now. Now I believe the hospital, COVID is very important. I believe, yes, we had to do our part. We all as psych nurses, we are nurses first, but we want to support COVID. We want to help out as much as possible. We willingly went to Gracie Square to help out for the, we want to help our people as much as we can, definitely. But they said, we'll come back in May. They promised us May, we'll come back to the Allen Hospital, we'll take care of our patients. However, now it's a different story. They say, they don't know when. They might open a med-surg/psych unit. And the unit right now is completely empty and rearranged so that they cannot have psych patients in that unit. They have too much ligature risk. I believe Lana is going to talk a little bit more about the current situation.
I'm sorry, what was the last thing you said? Too much what?
I believe Alana is going to continue.
The ligature risks.
Ligature.
Before that,
Things in the room that they could use to hang themselves.
Yes, like they installed oxygen, vacuums,
IV poles even.
Yeah, IV poles. They installed cameras in the rooms. The unit's completely different. It's not safe for them to put patients there. They could definitely self-harm. They could definitely injure themselves with the new equipment that they did install in there.
what was the word that you used?
Ligature. Ligature.
Oh, ligatures. Oh, okay.
Yes, sir.
Okay.
Yes.
All right. All right. I'm sorry. Alana, did you want to continue?
Sure, yeah. So I also wanted to emphasize the fact that the psychiatric nurses were taking care of COVID patients while we were at Gracie Square. And that's important because now Gracie Square refuses to take COVID patients, and they are allowed to do that. So there are very few centers located within a hospital that will accept COVID psych patients. So instead they end up going to general med surg floors, and often they could really benefit from, frankly, a psychiatric unit inside a medical facility. So Chris went over, we were switched abruptly to Gracie Square in mid-March, brought back in May. And so they have decided to transition our staff to medical surgical nurses. We were told that all of psych within our cluster, which includes all the psych nurses at 168th Street, would be undergoing this training. I've checked in with at least a half dozen nurses from 9 Garden North, which is the psychiatric unit that's the only one that's been kept open at CUMC, and none of them know about this cross training, and they're not currently doing it. So our concern is that this is really Presbyterian trying to permanently close our unit. And we know now there is a mental health crisis, without a doubt. We had a major suicide within our own hospital system, Dr. Lorna Breen. It's just unimaginable, especially now that unit lays completely empty. Somebody correct me if I'm wrong, but I was told by several sources that that unit was never at capacity and the field hospital was never at capacity. So what I'm getting what I'm getting to is we are currently being transitioned to med-surg. All per diem nurses currently are out of work. So these are nurses that have been working for 30 plus years as psychiatric nurses. Some of them have disabilities that make it very difficult for them to do that work. And they are now being transitioned into med-surg with messages from Presbyterian that are essentially, we don't know. And normally, under normal circumstances, Presbyterian needs to go through a regulatory process with the Department of Health and the Office of Mental Health to close down a psychiatric unit. But some executive orders by Cuomo and the metrics to reopen New York State have made it so that psychiatric hospitals, not just in the city, but all over the state, are closing down their units. So, and this is also, let me just add, I am not even sure if Cornell's psychiatric unit is open yet. They're non-union, so we don't get to know about that. Like, we don't really hear much about that. But so keep that in mind, and then keep in mind that the psychiatric units that are open are going to be at 3/4 or half capacity just to begin with. So we're not sure what's going to happen, but we are really concerned for our patient population. As we know, they are predominantly homeless, on Medicaid. Some of them are uninsured, so the unit may not be profitable for that reason, but those people may be uninsured because they are not able to advocate for themselves. So it's predominantly a unit run by people of color for people of color with serious mental illness and substance use disorders. Many of them have legal histories already. And so we don't know what's happening to them. I'm really trying desperately to track where the overflow is going. And that's proven really difficult. But what I can tell you is that people are suffering and that unit is empty.
Well, that is pretty dispiriting. I've been asking this question all along. I couldn't understand how they could just close the unit without going through the regular Article 28 process. So what you're saying, and maybe Julia, you'll be looking into this further, is that the governor has issued an executive order that allows psych hospitals to close?
Not quite. So there's an executive order 202.10. So the executive order releases liability during the period of COVID for major hospital systems to do what they essentially see fit to control COVID. And the metrics to reopen the state mandate that there needs to be a 30%
excess capacity.
I'm sorry, 30%, excess capacity in case of this next surge. And those words are important. In case of, we do anticipate a next surge, but is it going to be worse than the one that we faced first?
No.
Traditionally, that's not how it works, especially with the measures that Governor Cuomo has taken. So here we are stuck in this bind where they have been able to get around these regulatory agencies. And we actually have been working with elected officials to try and garner support for our patients.
Well, I think that may be the key to this, because you're gonna need to have the elected officials pushing to get this thing done, and to get the psych unit restored to the hospital.
Steve, what it is, it's a de facto closure. It's a whole lot easier to call on reopening than it is to close. And all the excess capacity that is demanded is being held by shutting psych units. Instead of every unit taking their fair share, it's close down the 25 here, close down the 25 at Brooklyn Methodist, have another 25 that are shut down because they're going to remodel. I mean, it's outrageous what's going on.
Yeah. All right. I
So Steve, I just wanted to add something since we're very concerned that the psych unit is not going to be opened up again. We started reaching out, of course, to CB12. We've started reaching out to our elected officials who are covering New York Presbyterian. And actually, we already had a virtual visit with Senator Jackson. And today, right before we got on this meeting, I received the letter that we requested from Senator Jackson's office demanding, it's a letter to New York Presbyterian that they've delivered to New York Presbyterian, and it's demanding to open the Allen Psych unit, which with the same concerns that we have. And if I may just share the screen, I actually emailed it to you, Steve. I cannot share my screen.
When did you send it to me?
Right when I got it from Senator Jackson's office, maybe around 6:30ish. Your meeting was already going on.
Okay.
Yeah, so it should be in your
All right.
your email.
Okay, I'm going to talk to our board chair, Eleazar Bueno, and see whether he would be willing to do us a letter as well. I mean, I think based on the fact that we've already done a resolution, that this community board has already taken a position, I don't know that we would have to, I would hope we wouldn't have to wait till September to do another resolution. I think we have the basis for doing our own, to doing a follow-up letter ourselves.
Steve, I just wanted to let you know, can you hear me? I just wanted to let you know that Senator Jackson's representative is actually in the other part, in attendees. It needs to be moved back over to panel.
Oh, okay.
Just in case they wanted to comment about that because the name came up.
I thought I saw him as a panelist. Chris
He
Nichol?
must have came off, and when they log off and log back in, that happens.
Hi, folks. Sorry about that.
Okay.
Yeah, I just briefly echoing what Julia said. Our office bottom lined the drafting of the letter in collaboration with NICENA, and several members weighed in on the language, and we garnered signatures from the borough president, from Assemblyman Taylor, and from Councilman Rodriguez. And we sent the letter to Dr. Corin this afternoon, right before your meeting began. So we hope to have a response by the end of July. We've basically said we know time is of the essence, and we expect to hear back about a date for reopening the unit by July 31st, I believe.
Well, Chris, I think that's great, but I would suggest that you also send that letter and address it to the state health commissioner and the state commissioner of mental health. Because
yes, they've been in touch.
We need them to weigh in. I don't know that, with all due respect, I don't know that Dr. Corwin is going to be somebody who can be easily persuaded on this question. And I think the state needs to realize the ramifications of that executive order.
I agree, and we plan to follow up with them about this letter. We have a good contact with them since Senator Jackson took office in January of 2019. We've been in touch with both OMH and DOH, so they're aware that our eyes, the whole community's eyes really are on this facility.
All right, very good. All right, so let's work on this. Let's work on this together. All right, very good.
Very bad.
Yeah, oh yeah, well, that too, yes, I take it, yes, very bad. All right, so Julia, Alana, Chris, do you have any last words?
I just want to say, I know that our census sounded low. There was a period of time where there was a hiring freeze on our floor. And so there were several times where we were told as RNs that our census was going to go back up to where it was. But that unfortunately never happened. But that being said, we discharge over 700 people a year.
What was that word, charted?
Discharge. We discharge over 700 people a year. And of course, part of safe discharge planning is to give them a safe discharge plan back into the community. But those, there's some people who come back, but for the most part, that gives you an idea of how many people our small unit helps every year.
Right. All right, that's, yeah, thank you. That's a good That's a good number. All right. All right, thank you. Thank you to the three of you. And Julia, I want to be in touch with you on this, all right?
Thank you. Thank you, Steve, for giving us the time in this meeting. Thank you to the rest of the committee.
Thank
All
you
right.
very much.
All right, talk to you soon. Betty, Betty, are you still with us?
I am, yes. Can you
Okay,
hear me?
okay, we're up to you now. Report on Isabella.
Okay, all right, I have a couple of things to say. First of all, as of a couple of days ago, Isabella is a COVID-free facility. Nobody has COVID within our facility. All staff members are tested according to the governor's executive order every week. And every day that you come into the facility, you're tested for temperature and you're asked a battery of questions, but then every week you need to be tested for COVID. We are permitting window visits for our residents. So what happens is that the family will call the social worker and we will arrange a time when we can bring the resident downstairs. We have a variety of windows in the front and the back of the facility, and we can arrange a window visit. And of course, the audio capacity for people to be able to hear one another. There has been some changes this week with the federal on the state level to permit in-person visits, but in order to qualify for that, a facility, as of July 15th, a facility has to be 28 days COVID-free, and then they can set up or follow the parameters for in-person visiting. We just started to be a COVID-free facility, so we're in the start of that cycle. And if all goes well, sometime within the next 3.5 weeks, we should be able to provide in-person visits, which will be very important since there have been no in-person visits since March 12th. We provide phone calls and video chats through our recreation therapy department so that residents can remain in touch with their family and friends throughout the day. With regard to PPE, we have a sufficient amount. However, New York City is no longer providing PPE to nursing homes. So we have to go out on the market and continue to buy it from our various vendors. With that in mind, I will bring up the fact that this particular whole episode of COVID has been financially devastating to Isabella. Our unreimbursed expenses total $4.6 million. It's a lot of money. We are appealing to the federal government for some support. But of course, you know that that's a work in progress and who knows where that'll go. I need to say that on top of that, the state had cut Medicaid reimbursement by 1.5% as of the early part of this year. And since 86% of our residents are on Medicaid, that's quite a hit. That's another $1 million on top of the 4.6 million. So we are financially in a very difficult situation at the moment. The good news is that our staff and our residents are COVID-free, and that's really important. And, it's been a very difficult period of time. Just to let you know, we also have communication for families. New York, as I mentioned in one of my earlier meetings, New York State has a website where you can see, if you want statistics on what happened in Isabella and all of the facilities within New York State, you can check the New York State Department of Health. And they have those statistics. So we provide all of that. We also have phone numbers for family members to call in and speak to a social worker 24/7, not 24/7, I'm sorry, 9 to 5, 7 days a week, and get information with regard to a loved one. So it's available. And we also have, we only have social workers answering the phone. So it's all HIPAA protected. And we're able to get information on that individual for that family member and get back to them right away. And what am I missing here? Pretty much, it's a bilingual helpline or hotline, if you will, for the family. And that's it for now. That's all I have to report at the moment. Anyone have questions?
Did you ever get the written report from the State Health Department on the inspection they did at Isabella?
No, I know they've been in many times. They're not just to Isabella. They've been in all of the nursing homes a lot because they want to make sure that all nursing homes are compliant with the governor's mandate for testing, etc. I know all of our residents were tested, etc. Weeks and weeks ago, and we continue to maintain that. I know I haven't gotten any written report from them.
All right, because, you know, the New York Times did an article back in early June that seemed to refer to as though they had seen the report.
I haven't seen anything. I'm working from home, so I'm not in the facility.
All right.
Yeah.
All right, I'll follow up with you some more on that later.
Okay.
All right, any questions for Betty?
Mhm.
All right, very good. Well, Daryl, are you checking the Q&A? Daryl?
Yeah, are we ready for new business or are we?
No, but
Oh, we're gonna talk about the firework, yeah.
Yes, yeah, but it said we had 23 questions?
That's right, I'm not deleting them all.
Okay. All right, very good. All right.
A lot of them, yeah, we answer in real time, so.
All right, very good. All right, so there are no questions then for Betty? Okay, we're up to the discussion about fireworks. Hopefully we won't have too many fireworks about fireworks. But this is a really persistent issue in our community. It went on for weeks before and even after July the 4th. And Tanya, do you want to lead off the discussion?
I mean, yeah, I helped to moderate this Facebook group about just noise in general, noise pollution in general in our community. You know, when we started out back in late May, we only had, you know, we had less than 100 people. And then when the fireworks started, it ballooned. We now have 500, just about 500 members of this group. The fireworks have been going on. Where did Steve go? Is he still here? Oh, sorry, I didn't see you. Oh, no, the fireworks have been going on for forever. I mean, literally starting in right around the time of the protests, the George Floyd protests. That's when I started.
I would not connect the two of those things. I don't think one has anything to do with the other.
I do, but we'll get to that later. But okay, so for the purposes of this introduction, so it started around that time, around early June, and it's every night, every single night, weekdays, weekends, like literally people were not getting sleep. It's just unbelievable. And the problem has been, again, when we bring this issue up, people say, well, you know, it's just the culture of the community. Or let people get it out of their system. That came up at our last general board meeting. Oh, let them get it out of their system. I'm like, I was locked up too for 3 months, you know, just like everybody else and stay at home. And I didn't go out. And my first reaction after we were able to kind of venture out a little bit more was to go out and light fireworks every night. Like, it just like, really, what does that have to do with anything? So literally it's just unlivable. I mean, and for me, it's not just about fireworks. It is a persistent problem of just general disrespect for people in this community who don't respect other people. It's about just noise pollution in general. And I have been dealing with this for 14 years. Since I moved here, I have been contacting all the elected officials, going to the 33rd precinct, talking to everybody there from the captain down about this issue, going to the community, the police precinct community council meetings, bringing this up, and you get nowhere. Nowhere.
I think it's been worse this year than I can recall in.
Right, the fireworks. The fireworks were definitely worse this year, but no one did anything about it. We were allowed to live in terror, and that is unacceptable. And all these elected officials, shame on them for allowing this community to live like that, and no one doing anything about it. Shame on the police that allowed this to continue. Shame on the mayor's office. Anybody that allowed this to continue. All of the elected officials. Anybody allowed us to continue to live like that. That is shameful. And I don't know, you know, and I want answers. Why were people allowed to Why are people allowed to be terrorized like that? I had people contacting me because of my relationship with that Facebook group saying I'm having mental stress. My dog, my cat, my dogs are stressed out and peeing all over the floor and everything. I don't feel well. I'm not getting sleep and I'm not feeling well. I wasn't getting sleep either. Right now, this is not even my apartment. I am not even living in my own apartment that I pay rent for, because ignorant people choose to do what they do and no one does anything about it, and it needs to stop. It's unacceptable. I am tired of talking about this. And I think this is a buildup, Steve. I really do. It's not, yes, this year was worse, but I think this stuff has been building up and allowing it to be this way for a long time. For those of us who live on certain parts of this community, this has been a constant problem. Just because it's now reaching out to other parts of the community because whatever was going on there, and I have my own theories, but this has been going on. I've been living with this type of nonsense since I've been here. And what the response I get, even from people on this board, is this is a community, this is how we live, go away, shut up, deal with it. What kind of nonsense is that? And I want answers from these elected officials that allowed us to live in terror. Did nothing about any of this and allow people to live this way. They're going to pay my rent, the place I can't even live.
All right. Well,
I'm sorry, Steve, but this is ridiculous. This has been going on for too long, and I'm over it. You don't even know how many 311 complaints I have logged over the years. That no one does anything about. The police looks at it, closes it up 2 seconds after opening it up, and they don't even bother to do anything about it. And then you have people say, oh, well, don't call the police, don't call this. And what are we supposed to do?
Right.
They were told us to call 911 at first when we were calling about fireworks. They say, call 911.
Right. Right.
Steve, I'm sorry. I just had a few things, and I have things to say about this too, but I'm going to save that for later. But I just want to point out a few things in the chat.
Don't save it for too long.
Okay. Some folks specifically pointing out again 161st Street, 214th Street, and Seaman Avenue. Tanya, can you say what the name of the Facebook group is? Some folks want to join that. You're muted.
What? How could she be muted?
Yeah, I do it to myself too, believe it or not. Okay, the group is called Wahi and Inwood for Respectful Decibel Levels.
Wahi and Inwood for respectful
decibel levels. And I can't, because I can't share anything in the chat or anything. So I'm gonna people will have to just find us that way. But yeah.
And I had a question for you, from me. Because I know where I live, I had it, like you said, early June through July 4th. It kind of stopped. I hear like one, maybe at 11 or midnight, and it's nowhere near what it was. But has it slowed down where you are? Or
I mean, it still occurs. I mean, it definitely, to me, it felt like it slowed a little bit, but there was still fireworks going on, and people are still reporting fireworks, and I'm still seeing some firework activity. It's not like it was, I would say it's not like it was in June and up through, like you said, through July 4th, but it's definitely a problem. My issue is, why was this allowed to go on? Why were we allowed to live like this? There's no excuse.
It's too bad Curtis isn't still on, but and maybe someone else knows. I know folks talk about the precincts and the community councils. What about FDNY? Are they not involved in this at all? Have they?
FDNY, we were given a hotline number to call FDNY to report fireworks. It was like one guy, and he said all he's doing is just doing the same thing we could do. It's just telling the police.
Well, I think FDNY is involved because there have been 2 fires in Inwood, and I know there was one day in the park when there were 4 fires.
But he's talking about having to be involved in solving the problem and us to report, not have we had fires? Sure. And even with those fires, nobody did anything. Somebody's
was-
house burned down. Nobody did anything.
What was that second fire, which I think was on Sickle Street? What was that caused by fireworks?
I don't think the
It
report.
was a whole apartment burned down on Nagel Avenue.
Oh, no, I
in
know the
corner
one
of
on
That's
Nagel.
Dykeman.
the one, Steve. I don't think the report has been issued yet. I haven't heard an update.
That's
well,
correct. It is likely fireworks, the one that was on St. Nicholas in the 180s, but it is not yet determined. But
I'm
there
sorry.
was one,
there-
there-
No,
There
there was
wasn't-
also, Natalie, there was also one on Nagel and Sickles. So in addition to the one on Nagel and Dykeman, I think there's one near Sickle Street one night. Like, on-
Natalie, are you saying there was a fire on St. Nicholas that was also caused by fireworks?
that was also likely caused by fireworks at around the same time as the one on Nagel.
St. Nicholas at 180th Street?
And think between 186 and 187th. I'll get you the
Steve?
the email from Fabrizio from FDNY.
Thank you now. Steve, can we let some of the people who are on the community tell their own experiences, because I can't speak for everybody.
No,
so I would just can we open up and unmute people so they can talk?
Yeah, absolutely. I mean, I don't know how to do that, but we should do that.
It doesn't show me how to unmute them.
I
I don't have.
You
the
would
capability.
have to go, whoever's gonna monitor this, Daryl, whoever has to go by the list, down the numbers and ask them, give them the permission to talk. You cannot set them off all at one
Oh,
time.
so I can give people permission to talk?
Yeah, like for instance, you can say 694, the number ending in 694. I'm gonna give you permission to talk now. And so you hit allowed to talk, and that person.
Oh, okay, I see. How about
user 694? Are you on the call?
694?
Yeah.
Hello?
Cell phone ending in 694. Are you on the call?
Yes, I am.
Do you have any questions regarding fireworks?
No, I'm just I'm a nurse from Three River East that was just listening on the call.
Well,
I don't live in that area.
The best thing to do in this situation is go through the Q&A. These people have access to the Q&A, so if they indeed have a question or want to speak, they can go through the Q&A, and then we can switch them over.
There was somebody with phone number 525 that wanted to talk and wanted to say something for a long time. Can we give them?
I just put them in. 525.
All right, good. So, yes, it's me, Migdalia. Steve, Tanya, I know everybody here on the line. Actually, I don't know what's going to be done about the noise in this community, but it's just really out of control. And this is something that we all said over and over and over and over and over again. Where are the elected officials, Carmen de la Rosa, Idanis Rodriguez, when they want to go in somebody's pocket to get money, and I'm not talking about Carmen de la Rosa, I'm going to talk about Idanis. When he wants to get in people's pocket to get money for his campaign, this and that and the third, he calls the press, the restaurants, he puts them on the pedestal. But when it comes to these kind of community concerns, where is he? Missing in action. Carmen de la Rosa, where are you? We need you now to help us navigate this nonsense that we go through. I don't understand. People that are working for us, we paying our tax hard-earning money, 34 precinct, 33rd. Where are these people? Where? And what is the community board going to do to help us? We need help. This is serious out here. It's all free for all. We do what the hell we want, when we want. Rebels right up and down, up and down. I'm surprised they haven't killed anybody. But just, the stress of all this crap. How are they going to help us? Why they are not on this call? That's what I like to know.
All right.
That's what I have to say.
We also have Bernard Grobman.
Yes, yeah, I feel you. I totally agree with you, Tanya. That's all I mean, really, if I were on there, I would have said exactly the same stuff. Tonight, I actually had some success. I called up the NCO for my sector over here in 33rd Precinct, and he actually showed up, and he shut down 2 guys with blasting stereos out on the street. He actually did it, but he did tell me that they have no teeth to what they do. In other words, all they can do is tell the guy to turn it down. They cannot tell anybody to move along.
Yep.
They can't give them a ticket if they don't move along.
Yep.
They can't do any of that.
Yep.
And those are orders from City Hall. It has nothing to do with anybody else other than City Hall. And we are the only people who can change that.
Yep.
Because we vote for these guys. And I moved into this neighborhood last year, and I knew it was a little bit noisy and stuff. I got that. But my block was fairly okay. This year, I went through a giant, huge 2 block parties on my block. I had it in stereo till 3:30 in the morning at Yankee Stadium volume. I'm a guitar player. I do that for a living. I've never been on stage with volume like that. My building is built, it's a brand new building. It's built like an office building as far as noise control goes. And it sounded like it was in my apartment. That's what was going on. And every call to 311 got closed out in 2 seconds. I mean, I have a list of them. I sent them to Curtis. I mean, it's like this huge long list. And finally, I got in touch with the NCO, and he was pretty cool, but he told me there's only a certain amount of stuff that they're allowed to do. And I think it's ridiculous. I mean, it's even a COVID hazard. These people were hanging out with no masks, hugging and everything else with no masks, all next to each other all night long. They can close down a restaurant that's going to pay taxes, but they can't close down this illegal crap on the street. There are laws about that.
Exactly.
There are laws for this, and they are breaking those laws. Okay.
And Tanya, if I could just say to you, to one of your earlier points too, and just so people know this, there are members of the board.
Yes.
Said this is just noise. Who suggested, why don't you go up to the people lighting the fireworks and say, do you mind not doing that?
It's ridiculous.
And so I was at a
No. We had. I'm sorry. We had a board member at the last meeting who said, "Why don't we just let it happen? That this is the way it is in the community, and you should just let it happen. That we're being overly sensitive." And I had to respond to him and tell him that what he was talking about was out of control and was inappropriate for this neighborhood. So.
I went to a borough service cabinet meeting and asked the FDNY representative, and he just thought that notion was ridiculous. If people have the fireworks and paid for the fireworks, they're going to set them off.
Well,
you're not going to talk them down.
The other thing you brought up.
What's going on in the mind of somebody who's doing that? I'm not going to walk up to that guy.
No, that's right. That's right.
There is someone else who has their hand up.
Nancy Preston has her hand up.
Yeah, I'm gonna allow.
Okay, hi, thank you.
Hi.
Yeah, and just, yes to Tanya and, and to Bernard. And we're here in the health committee because this is a health issue. It's a public health issue. And the mayor classifying this as quality of life, therefore telling NYPD from the top, you are not to enforce quality of life. They have been told this, to step away, to not enforce this. This is not quality of life. You can hear it. This is public health, and it really needs to be established as a public health issue. World Health Organization, CDC, recognize noise as a health hazard, exacerbating many conditions. My husband has PTSD, right? So, you can imagine what people with PTSD went through this past month. And it is an absolute disgrace to see that, our elected officials twice within 2 weeks were able to have press conferences on Dyckman to promote the open streets, but then they were nowhere to be found to advocate for the community under this condition that has gone on, and it's still going on in certain areas. I'm hearing over at Inwood Hill Park on that end, and people are still being terrorized, not to the same extent, but it's still happening. Thank you.
And at 4 in the morning.
And I wanted to say too, I wanted to say that, you know, I had sent an email to Carmen De La Rosa's office, to Udonis Rodriguez, about this issue, and Senator Jackson about this issue. I didn't hear from anybody but Senator Jackson's office to respond to our concerns, who actually took the, Chris, who's on this call, actually took the time to meet with Nancy, myself, and the administrator of the Facebook group to talk about these issues. I do want to acknowledge that happened, you know, and I don't know what happened with everybody else, but you know, we're gonna need their muscle to do something about this, because as community members, we can only do so much. As elected officials, they have the muscle, they have the connection, they have the proximity to City Hall to actually, you know, get these issues and these concerns in front of the people who need to know, who can make these changes. We can't do that. So we need them to step up. I think, and I'm going to say this, I think a lot of people are thinking about votes for the future. And they're not trying to piss people off. They're like, oh, you know, we're going to just let this go because I'm going to need their votes in about a year. I don't care about what people are running for. This community needs help now. This community cannot be, you know, put in the trash because you want to appease people whose votes you think you're going to need for your next upward mobile climbing on the political ladder.
Well,
this needs to be dealt with now.
Yeah.
Well,
And let's be honest. We will not live through this next summer. We will not.
No.
This is ridiculous.
No, I mean, if that's anybody's political strategy, that's a ridiculous strategy. I would argue the people setting off those fireworks are not your likely voters. The people who are concerned about this issue are the people who are more likely to vote. Those are the people.
Exactly.
Those are the people you're pissing off.
And those are people they're ignoring.
You're losing their votes. You're not gaining any votes by not acting on this issue. You know, those people who are out there till 3, 4 in the morning setting off fireworks, those are not voters. I'm sorry. They're not your likely voters.
Can we just going back to the chat real quick? There's someone who's been chatting a lot. It says anonymous attendee, but they're not in the attendee list. So I don't know how to let them talk. I apologize. I don't know, Paula, if you know.
Neither do I. If they're anonymous and you can't see them and I can't see them, we can toggle them over. Whoever's not listed on the attendees list, I cannot pull out of my hat. If they're not there, we can move them.
I do want to address anonymous attendee. You said, Tanya, can you run for mayor? Let me tell you something. They won't even let me have any position on this damn board, let alone the mayor's office. So good luck, because I speak truth to power. I speak truth, and I'm not here for the okie doke. I am here for what is going on. I'm here for this community. I don't have time for the nonsense. Okay, I don't, and that's exactly why I don't have any position on this board, and will continue to do so as long as the powers that be are where they are. Thank you.
So anonymous attendee asked a very important question. How do we change this? Instead of like going over what the problem is, why don't we talk about solutions?
Right.
Well,
what
I
solutions
think
are we going to have?
all the elected officials in one room.
Ask the elected officials what the solutions are. They have the power.
Well, I tell you, I don't.
They can pay attention to it. They're not even paying attention to it.
I don't want to wait for them to come up with something. So my suggestion would be that when we reconvene in September, we do a resolution, which is the way our community board transacts business, and we send a resolution to the mayor and to all the elected officials saying that they must come up with a strategy for next year that deals with this problem. They cannot let this problem exist the way it existed this year. However they want to address it, they are, you know, the police and the other people are the experts. They need to come up with a strategy. They need to cut off the fireworks that are being sold in Pennsylvania and upstate. They have to prevent them from coming into the city. They have to deal with the people who are out there till 3, 4 in the morning. They have to deal with this problem. They can't just ignore it. And so I think we need to take a position as a board members. And I think in the meantime, we need to talk to our fellow board members, because I am somewhat fearful of there being a split on the board and some of our members saying that we should just allow this to happen, that people enjoy it, and it's a part of the regular character. It's a regular part of the regular culture or character of the community, and we should not interfere with this. And so I think we need to do some homework ourselves. And I think what I heard a little bit maybe from Curtis tonight, which is that maybe he is in sympathy with taking this kind of position, because I would want to do it jointly with the Public Safety Committee. And I think, we need to go on record, and the way to go on record is to pass a resolution.
And we didn't even talk about the trash mess that's left over from all the fireworks either.
My gosh.
Right,
In the
right.
parks and
I
everything.
was cleaning it up. I got pictures.
No, right, on the street corners. And I saw somebody post a couple of pictures on Facebook, a ton of stuff right on, they left it right there on the street.
Oh, yeah. Gunpowder everywhere.
Yeah.
So
Can I
Steve,
just say one more thing?
yeah.
It's Bernard. I sent an email to the mayor's office, and they did respond. They said that they take quality of life complaints very seriously, and for me to report it to 311.
Yeah.
Okay, I'm sorry. Yes.
Well, yeah, I know that's I
Where's
needed to
that
say
laugh
that because
emoji thing?
we needed a little levity to lift the spirits here.
I
think
he's-
Fern has
he's
been
not
trying
running.
to talk. Fern has been
I've
trying to
been,
say
running
something.
for anything
patient,
else.
guys. I've
Excuse
been
me.
patient.
Fern has
I-
been trying to say something forever. So just so you know, Steve.
And Natalie has her
I'm
hand
sorry,
up after.
I can't,
Fern.
too many people are talking. Who wants to speak now?
Fern
I
had her hand up forever.
Okay, and so has Natalie. Natalie has her hand up as well.
Oh, I'm sorry, Natalie. Okay.
Okay, but Fern, go ahead.
Okay, I just want to bring a little historical perspective here. We've done a number of resolutions about noise pollution in this community, going back decades. There was a huge issue, I know Steve will remember because he wrote it, about noise around Isabella with motorcycles.
Yes.
There was another huge issue in the neighborhood. I mean, I was on the board for about 8 years in various decades. So I know that this has come up before, but Steve is right. It's a lot about the political will of the board members. So you really do need to have that conversation among the board members, because you've got the language already drafted, almost 3/4 of it is already in previous resolutions. But if you don't have a solid majority of the board in favor, don't bother. It's just going to be a gigantic fight that is not going to be worth having. So you've got to do the pre-homework and
Right.
figure out that you've got supporters on this.
Yeah, actually, I'm glad, Fern, I'm glad you raised referred to Isabella. Betty, I've been wondering, how has Isabella been handling this problem with all the fireworks around your buildings?
Well, most of it would have been on Amsterdam Avenue, in
Yeah.
the park. To be fair about it, we've been so consumed with dealing with COVID, to be honest with you, that that's not, it's been an issue, but I can't say that, we're fixated on that. We've been dealing, it's been a crisis with us for the last 4 months.
Right.
So, I can't say, but I do remember that was done by Leslie Foster.
Yeah.
And you.
Yeah, right, back in the aughts, as they say. And it was
Yeah.
all about motorcycles and noise
Yeah,
on the Amsterdam Avenue side.
Yeah, we actually.
There was
the
one with
council-
fireworks too.
Yeah, the
Right.
council member that I previously worked for, Stan Michaels, actually passed a law declaring a noise-free zone around Isabella, or around nursing homes in general, having additional fines for noise violations around nursing homes. But in this particular situation, do you know whether Isabella called upon the police to deal with any of these fireworks issues, which probably were occurring right outside your building?
I don't know, and I say that because I'm working from home. I'm not at the facility mostly. I can find that out and I will get back to you.
Yeah, I'd like, I would appreciate knowing, because harking back to that situation where we determined that noise was a particular problem for nursing home residents, that if, I think this might be another situation where maybe this law was not, this particular law was not being adhered to at all.
Yeah.
And Natalie had her hand.
Oh, yeah, Natalie, please.
Hi, well, Steve, I want to thank you. I think that's great information about that law about noise being banned around nursing homes, because now I think I'm just going to put a sign on my building that says that I'm a nursing home. And I think we should all do it and then see if it works. So our CB12 family goofiness aside, I think that this is a useful approach of doing this as something that is crossing the purviews of many of your committees, and that this goes beyond a quality of life issue, and which is why you're dealing with it here, and layered onto the collective trauma of this pandemic.
Right.
And then this takes on a very different meaning and a different impact when these loud, disruptive, disturbing noises take place. Everybody has different reactions. I understand that. I was very fortunate my entire life. I had pets who would watch thunderstorms and fireworks like they were movies. But all you have to hear about is one example of a neighbor who is suffering, and that should change your mind about how you want to act. And so I trust you guys to be able to articulate that and bring together that conversation that you've been having for many years, but make it very topical to what's going on now.
Yeah, very good point. No, I do want to make this a joint resolution of as many committees as would be relevant in order to make sure we line up enough support within the board.
Hey, Steve, sorry.
One second. Claudia, there's somebody on the chat named Claudia who wants to know where to send it, the addresses of the problem locations. You should send them to the community board office, which is at 530 West 166th Street. Actually, you could just email me, Steve Simon 765 at gmail.com.
So I had a question, and this stems from someone else, Nancy's question, I believe, about decibel level, right? Yeah. So we have laws about a decibel level that cannot be met or should not be met, right?
Yes.
Is it possible to maybe propose another that would be for a longer duration at a lower decibel level?
Well, I don't know that you have to worry about that, because I'm pretty sure that what these people are doing with their fireworks easily violates the existing code. I don't know that you have to worry about lowering or changing any of the standards. I'll take another look at the noise control code, but I'm pretty sure that you're not supposed to hear something at this kind of level from something like 50 feet away, and you can hear it from blocks and blocks away. So it's just ridiculous. I'm sure it easily violates the noise control code.
And I asked before about having noise ordinance signs. I went to the police again and I said, what can we do? I said, what about noise ordinance signs? I've been coming in with solutions with scroll length, 311 calls, data and everything. And they said, well, you have to call DOT. They said the DOT. So maybe traffic and transportation might have to get involved in this as well, because I called DOT and I never heard back from anybody. I called several times to the information that I was given, and I never heard back from anybody about noise ordinance signs. They have them in other parts of the city. They have them in the Upper East Side, Upper West Side. You see those noise ordinance signs. This kind of nonsense will not be going on there. They will shut that down. And so, but they have those signs. We don't have those signs. That's another thing that could help with this problem too,
Get Debbie on this as well.
Yes,
yeah.
Debbie.
Yeah.
Do me a favor. The next time you see one of those signs, take a picture of it and send it to me.
I have to go to Upper East Side. where the rich people live. I have to go where they go.
Well,
They might stop me while I'm over there and say, "What are you doing here?" They might get me, you know, like
You also said it was on the Upper West Side.
I
So
don't
let-
go there that often.
Okay.
So can I just say real quickly to, it's been wonderful, the people from the public that have been on here. This is obviously one of our non-regular meetings. Our next full board meeting is at the end of September. It would be great if folks were also there for the public session to talk about this, because unfortunately a lot of board members just don't get it and haven't heard from the public enough on this issue.
That's a good suggestion. I mean, we're also having aren't we also having a committee of the whole meeting later on in July?
Yeah, in July. Yeah, we're having a committee. Oh, yeah.
That's my question, Steve. If we can't draft a resolution and present it to the committee of the whole, it still
No.
would have to wait till September?
Yes.
Okay.
But Steve, okay, so beyond a resolution, how do we as a board hold all the other electeds accountable and hold the police precincts? How do we hold these people accountable? Because I feel like, yes, we can put out a resolution, and obviously you have done that in the past. And so how do we ensure that we also are taking that next step and holding people accountable for addressing these issues? Because they're going to look at this resolution, and trust me, it's going to go right in a file somewhere once they receive it. And what are they going to do after? Then what? So, you know, I want them to be accountable and actually, instead of telling me this is part of culture, and I will say people who say it's part of culture, you're actually disrespecting the culture of the people in this community by saying this level of ignorance is what goes on all the time. That is disrespectful. If that's to your own community to say this is part of the culture for people to act like this, that is ridiculous. So what are we going to do to hold these people accountable to say we need to address these issues? What are you going to do as elected officials, people who show up at our meetings and tout their next whatever, or who will hold a press conference about whatever, or who will hold in fundraisers for their next whatever? You know, so what are we going to do? You know,
Can I make a suggestion?
Who's speaking?
It's Bernardi. Yeah.
Go ahead.
Okay. First of all, there are laws, so they have to enforce the laws that are on the books.
Yes.
I could say it's my culture to go rob banks. Does that mean it's okay if I go rob a bank? Should I be allowed to just take the money and spend it wisely? I mean, you know, it's like, you know, it's not culture. It's law breaking. It's people who want to break the law. That's it. So there are laws. The law on fireworks, even sparklers that make no noise are illegal because they're a fire hazard. That's what the laws about fireworks are. It's a fire hazard. It's a danger. You can blow your hand off, okay? The noise thing, you have to have a permit to have a speaker, an amplified speaker on the street. I'm a guitar player. If I walk out into the subway and I take an amplifier down there, they'll bust me, okay? So that's all they have to do. They can also confiscate the speakers and give them a disturbing the peace ticket, which I hear is $450. And they don't get their speaker back until they pay the ticket. You know, so all they have to do is enforce the laws.
Yeah, but it's still about political will.
Right, exactly.
If there's not a consensus in this board of 50 people who represent this community, then there's not a consensus. And we're talking to each other, but it isn't going to make change. The change happens with the political will of the majority of us wanting the same thing. And we just don't know if that's entirely true. I would suggest including traffic and transportation and aging in this conversation, because the signage is traffic and transportation for sure. That's absolutely right. It's all signage is DOT. And the aging are very affected by the noise, very much so throughout the community. So
Right.
those would be my two suggestions.
Steve,
I'm
can I-
so-
And they have veterans groups.
I'm sorry,
Yes.
Fern, I missed your first suggestion.
Well, well, I was stuck with what you said originally, which was building consensus. And then I said you need traffic and transportation.
Oh, okay.
Because all signage is traffic and transportation.
Yeah.
And you need aging, because the seniors are disproportionately affected by this frightening noise.
Yeah, I don't know whether the signage actually comes from the transportation department. I'll look into that.
I think it does.
Well, let me check into it.
Steve, can I just share with you what I have been told when people have requested noise signage?
Yeah, go ahead.
We have been told that the neighborhoods where those signs exist, those are kind of throwbacks to different periods when they used to do that, and that they no longer do it because it causes confusion to motor vehicle operators to have too much signage. So you guys do with that information what you want. I also strongly recommend parks. My biggest fear is that I live next to a forest and that this is going to turn into an ugly scene from, you know, the news footage of California with an errant firework.
Yeah. Oh, yeah, definitely good point there.
And also, isn't this an issue that the public advocate might want to?
Absolutely. Since
do
nobody
something
is
about?
doing anything, maybe we should reach out to them. I'm all about who's going to be responsive. If you're not going to be responsive to your own community, well, maybe we should go out to the public advocate and ask for help.
Well, actually, this certainly fits
These
within
politicians ain't doing anything.
It certainly fits within a description of his office is to monitor city services. But listen, the Committee of the Whole is meeting on Tuesday, July the 28th. I don't see any reason why members of the public wouldn't be able to, should be able to call into that meeting as well and voice their opinions on this question. And I would encourage people to do that.
And, you know, I think someone else said too, it's like, this has been a great conversation, I think, but it's hard to have these conversations on the full board level. That's why we really need to reach out and talk to our fellow board.
Okay. All right. I think we have a good sense of what we're going to do. So I'd like to try to wrap this up because we are now going past 9:30. And Tanya, let's stay in touch and we can hopefully work on some resolution together.
It's for anonymous as it's, you said July 28th, right, Steve, is the
Tuesday, July 28th. I don't, is it at 6:30 or 7 o'clock?
That needs to be checked with the board office because unless they're going to have, you know, the meeting, it's set to be on the calendar, but if there's no agenda items or there's no, you know, I wouldn't know if it's gonna happen or not.
All right, so we people should call our, can they call the office or people answering the phone?
Ebenezer's phone is routed to the office, so anybody that calls the office should be getting Ebenezer.
Okay, great. So you can call 212-568-8500 and you should call in to find out if we're having a meeting on July the 28th. All right, so under old business, we have our monthly report from DEP on service requests from residents of Washington Heights and Inwood. There were 498 during the month of June. 154 dealt with hydrants running full. Another 78 hydrants that were running but not full. And then 36 complaints about dirty water and 31 complaints about noise from ice cream trucks. I sent this report to all of the committee members. We also have our monthly report from DDC about the water main and sewer projects in the district. The good news is that the one up in Inwood is expected to be completed at the end of the summer. That they're now at the 93% mark, and hopefully by the end of the summer it will finally be finished. Is there any other old business? Is there any new business?
There was something in the chat early on. So it says, blah, blah, blah. Assembly member Linda Rosenthal and Senator Luis Sepulveda recently introduced a bill to shut down slaughterhouses in New York, considering the nature of COVID. I looked into and learned that there was about 80 slaughterhouses in New York City, one in Inwood, and none in affluent neighborhoods. Are we doing anything to support this bill to protect residents from from health risks that come with having slaughterhouses, wet markets in the neighborhood.
I don't know, was it actually confirmed that, that COVID derives from a wet market? Was that just a?
Well, you
was that
see it in the plants, you know, in other parts of the country. I've heard it.
Oh, no, well, those are, I mean, those like, you know, the meat processing plants. I think, you know, that's, I mean, I think I don't know, let me check with Rosenthal's office on what the backup is for that bill. I'll look into it.
Okay, and does anyone know where the one in Inwood is? I do not.
Yeah, it's on, yeah, I think it's on, is it on Sherman Avenue, maybe?
Was it 10th Avenue?
On 10th Avenue.
It's on 10th Avenue.
On 10th Avenue, okay.
I walk by it.
Yeah, okay.
I seem to think it's like right off the corner. Is it near 207th?
Correct. By the
Yeah,
buildings.
Yeah,
Is it just, is it primarily chickens or I don't know what else?
Yeah, it's the vivero.
Yeah,
Okay.
chickens.
My poultry.
Yeah.
Hey, Steve, I think Claudia had her hand up. I don't know if we missed it before to speak. I don't know if she's still.
Oh, okay.
All right, let her speak.
Yeah, she's here. Claudia, you're
Yeah.
in now.
Yeah, hi, thank you for taking it. I am not sure if this was addressed before. I was out for a moment, but it was just going back to noise and, you know, the political will for enforcing it, enforcing the noise code. I was wondering if we had talked at all about just issuing tickets and that sort of thing so that it would be seen as less of a strong arm enforcement on something that seems like a minor nuisance, about, you know, being able to just take license plates of people who are playing their stereos for hours on end and, you know, just take the license plates. And that in the public safety meeting, there was Captain Bello from the 33rd precinct had said, well, you know, they're really trying to have a hands-off approach about what if somebody doesn't want to hand over their license, or what if somebody's drunk? They're just trying to avoid altercations. But if
confrontation, altercation.
yeah. And so I'm wondering if one of the solutions might be just a more hands-off, okay, here's the license plate number. Okay, this license plate has been reported 3 times for playing music at decibel level 300 for 6 hours straight. And I'm just wondering if, you know, finding some solutions that way could help create more political will for I guess I want to call it peaceful or sort of paperwork enforcement.
Yeah.
Well, let me say, you can lose your license if you have a certain number of moving violations. Is that? I'm not even a driver, so I'm not sure about this. So what is there a way to suspend somebody's license for other types of infractions?
Steve, this is what I've been trying to find out because all of, you know, I have known people who have gotten jammed up for sleeping off a bender in their car, even though they didn't have the car operating, they were just sleeping it off inside. And then other adult activities that take place in cars it's very selectively enforced. And I think that's the conversation that I think Captain Bello was trying to have.
What are you referring to? I'm just kidding. Don't answer that.
We're on YouTube. You don't want to get banned. But my first license exam as a teenager I took in Florida, so it was a different set of rules. And I'm like you, I'm a non-driver, so I never bothered to learn them past the day that you just take the learner's permit. But I do think that it's about, you know, Charlie Bello had asked the Public Safety Committee, what kind of policing do you want? What do you want us to go out and enforce? And I think that has to be part of this broader conversation.
Yeah. Well, that is
of how to get this done, whether it's the rebels, whether it's the fireworks.
Yeah, well, that's the central question hanging over the city right now. I mean, that's like almost the number one question facing New York City at the moment.
I wonder if I could add to that question, since we have the drag racing and the motorbikes and those things. Since, you know, the bridge, the Henry Hudson Bridge, it has traffic cams. I'm wondering if traffic cams, again, as a very hands-off, non-violent way of capturing license plate numbers of cars that are going way over the speed limit, or cars that are doing donuts all night long in an intersection. You know, if just asking for some more traffic cams might be one step that we could take forward.
Well, I don't know. I would like to see the cameras used to stop the people from bringing in the fireworks from out of state. I would like to see that we have some kind of, you know, we send police officers to other states to check on a variety of different like terrorism crimes and other things. We should station somebody right outside, what is that place called? Phantom Fireworks or whatever it is, this huge place that sells all the fireworks in Pennsylvania. They should mark down the license plate numbers. And if those license plates are coming over the GW Bridge, as soon as they hit Manhattan, we should stop those cars and empty out their trunks. I mean, there's got to be a way to stop all of these fireworks from coming into the city.
Well, I think that was de Blasio's approach, but we also, since they are illegal once they get into the city, we've got to enforce seizing fireworks at the point they're being shot off.
Yeah. Well, actually, when I hate to say this, but it was Giuliani, I think, who started something like this when he was mayor, and it was fairly effective. And you know, while he was mayor, we didn't have there were a couple of years we didn't have this huge fireworks issue. But and you know, maybe this is one thing we need to go back to.
But with the cameras specifically, I think there's also a budget issue, like it's a capital,
right?
The capital request, isn't it?
I'm not sure, but
because I know, you know, I live up close to Inwood Hill Park, and when after the 2004 murder of the Juilliard actress who I actually went to school with, they installed traffic cams in some of the parks, or not traffic cams, but they installed the cameras at the entrances to the parks and so on. So, I mean, I'm just bringing it up because they do exist up in Isham Park, for example, and one of the main locations where you hear a lot of noise is just down the hill from there at 5000 Broadway.
Yeah.
So, and when you hear them doing donuts, you think, well, wouldn't it save a lot of money actually, even if it's an expense? But wouldn't it save money on policing and, on having people go there to just have a camera that says, oh, this car going in donuts. What's that license plate?
I would also suggest, similar to what I said earlier, is that the committees do their budget cycle. A lot of them talk about it in September and October. So for that, it would be public safety as well as parks and cultural affairs.
Well, probably mostly public safety, because it would be the police that would have to put up those cameras. But the cameras they have are the red light cameras. I don't know how many we have up in our neighborhood, but they should catch that kind of the people doing the donuts as well. They're going through the red lights, aren't they?
Sure.
So we're almost
I can hear them right now.
mark, Steve. So
Yeah. Okay. So all right. Well, Claudia, thank you for that suggestion. And watch out for that violin you're holding. It looks like a weapon.
It's almost as loud as what we're usually hearing.
Yeah, I don't know.
If it could play over the fireworks, that would be.
Yeah, I wish, oh God, I wish that were possible. Okay.
How do we say the Q&A, Steve? How do we say?
I don't know. I want to save it. How do we?
I know you can say chat, but I don't know how to say the Q&A. I know you can just
Don't ask me because I don't know either. All I know that all that you guys have been doing for the moment I hit record is there, but I don't know the conversations in the chat if they're saved.
I think you could cut and
So right now, you, Daryl, Steve, and I have the same functionality. So if you don't see it on your screen on a way that you can save it, neither can I.
Well,
The
that's
only
really,
thing I have over you guys is that I can shut everything off right now.
and then we're gonna lose all the Q&A?
No, the way that you can save it is someone can screenshot it before you close out the meeting.
There's a lot of, there's like 68
It's a lot,
comments.
Right,
Sally.
go ahead
Yeah,
and
it's a
select
lot.
all for now and paste it into something, even if you lose the format. But as I've said before, the chat or closed captioning, open captioning that comes with a transcript is your best bet for saving the material for after the meeting stops recording.
All right, well, can somebody do a screenshot of the Q&A?
It's 68 comments. It's a lot.
Look, I was able to cut and paste it.
Oh, you did? Oh, perfect.
The format was really lost, but it's still there somehow. So that's.
I just wanted you to have that, Steve. That's because I know you
And I'll
want the
put
address.
I'm putting in an email to you and Paola.
Thank you. Thank you.
Thank you.
All right, so we're gonna bring the meeting to a close at 9:45, exactly 3 hours after we began. Thank you all.
Thank you.
And let's stay in touch.
Bye. Bye, everybody.
Bye.
Bye.
Thank you. Thank you, Tanya.
Bye.
Bye.